Hello, True Health Seeker, and welcome to another exciting episode of the Learn True Health podcast. You're in for such a ride today with Dr. Vienna. I can't wait for you to hear today's episode. You know, there's 53 days left till Christmas. If you're listening to this the day I publish it, if you're listening to it later, Christmas is just around the corner. And I love giving holistic presents to my friends and family. I'm going to tell you a few that I absolutely love. The magnesium soak. You can listen to my interviews. Just type in magnesium soak at learntruehealth.com and listen to those interviews. Absolutely amazing. Kristen Bowen was 90, I think she said she was 97 pounds, having 30 seizures a day, in a wheelchair, unable to talk. And now she's in perfect health. And she attributes that. One of the biggest things that helped her was her magnesium soak that she sells on her website, livingthegoodlifenaturally.com. Be sure to use coupon code LTH when you go to her website, livingthegoodlifenaturally.com. Coupon code LTH. I love the magnesium cream. I love the magnesium soak. You put it in a foot bath or put it in your bathtub for you and your kids. And I also love the magnesium muscle cream, which is amazing for aches, pains, and tension headaches. So that is absolutely must be on your Christmas gift list, your holiday gift list. My other great gift I love giving my holistic friends is Energy Bits. Go to energybits.com. Grab a few of the bags of Energy Bits for your sister, your mom, your best friend. They are fantastic snacks. You know, kids love them too because they make your tongue turn green or blue, depending on whether you get the chlorella or spirulina. They help to detox the body. They're filled with readily available protein and tons of vitamins. And I have I think I have 7 different interviews about chlorella and spirulina, specifically about the Energy Bits brand. And I've interviewed the founder of that company. You know, there's only 2 companies I know of that do not contain any lead in their chlorella. So if you buy some over the counter, go to some health food store, whatever, and buy some chlorella, there's going to be that little warning on it that says this, in the state of California, this causes cancer. That's because there's actually lead in those bags of chlorella. But in Energy Bits, in their chlorella, there's 0 lead because of their process of how they grow their crop and how they then turn the crop into the little edible tablets. So listen to my interviews on the magnesium soak with Kristen Bowen. Listen to my interviews about algae, the healing benefits of algae, and how it's such an awesome superfood snack to carry around with you. Listen to my Energy Bits interviews and use coupon code LTH at energybits.com and coupon code LTH at livingthegoodlifenaturally.com. Those are 2 amazing websites to check out for your Christmas gift ideas. Always use coupon code LTH. I try to get companies who I absolutely love and adore and recommend to always use the same coupon code. So just always try coupon code LTH on all these health websites and you'll be pleasantly surprised when you get a great discount. Awesome. Enjoy today's interview. Come check us out in our Facebook group if you haven't already. We have such a supportive and wonderful community. You can ask your health questions there and support the other members as well. Just search Learn True Health in Facebook and come join the excellent community, a very supportive, holistic community there in the Facebook group. Awesome. Have yourself a fantastic rest of your day and enjoy today's interview. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 450. I'm so excited for today's guest. We have Dr. Vienna Lafrenz on the show, a PhD in integrative medicine. Vienna, you and I met through my friend Jennifer Saltzman. You have a beautiful clinic. Oh my gosh, just a gorgeous clinic in one of the most beautiful parts, remote parts of Washington State. You're near, is it Republic, Washington? Is that where you're near?
Yes, I'm actually in Republic.
Okay, that was
Washington.
Republic that we drove to. Okay. Gosh, it's so beautiful out there. Oh, you're just in
It is.
Probably the most beautiful part of the world. I couldn't believe it. It's hard to drive the car because you just want to stare at nature and the mountains and the scenery the whole time. It's really beautiful. So you have this gorgeous clinic and oh, what a gem in the middle of nowhere to stumble upon you and all the work that you do. You gave a treatment to our son a biofeedback treatment to our son, and that was amazing, the results we saw. And then I was quite sick back in February, um, like just fever, gasping for air, burning lungs, sore throat, the works. And I was just suffering for days. I did telemedicine with my naturopath. I was on all kinds of supplements, and then and then you did a remote session with me, and this was like days into just like high fever, sore throat, you really burning lungs, hard to breathe. And at the end of the session, it was like the suffering had ended. You know, my fever broke, and slowly recovered after that. And you know, about a week later, I was back to my normal self. But it was like that was the point where the suffering ended. And I thought that was really interesting. That I'm always kind of skeptical but open-minded about, you know, things we can't see. Like, oh, energy work, something long distance energy work, and we can't see it, but so I don't know if it's I don't think I could say it's placebo because I didn't like believe in it, right? Like I'm like, okay, I'm open to it, but I didn't have like this strong belief like, yes, no matter what, I think this is going to work, because I was sitting there suffering pretty badly, or lying there pretty badly. And it was quite amazing that a few hours of the session, I felt my my body just shift into super healing mode. So that was my experience with it. But I've actually talked to others who have experienced the type of remote feedback that you do, including Eric Thornton, who I've had on the show several times. And everyone I talked to that has experienced the SCIO, which is one of the machines that you use, have all told me that they've had incredible results. So I'm really excited to learn more from you today about what remote biofeedback is, because I've had a personal experience. I've seen my son. I've talked to others, and what a great tool to have in our tool belts, especially when we've, you know, exhausted all the other resources. We're eating healthy. We're taking our supplements. We're getting plenty of fresh air and sunshine and walking. But if there's still something, you know, something not getting better, right, in our health, we should absolutely look to energetic
Right.
medicine. So I'm really excited to dive into this. Before we dive into what remote biofeedback is, specifically the SCIO and the work that you do, I want to learn a bit more about you. What happened in your life that made you want to become a PhD in integrative medicine, and work with people using these types of therapies?
Mm. Well, I'm glad you asked. So prior to that, I was an occupational therapist for 30 years, and I was working in nursing homes. I was traveling all over the United States. I was a consultant where I worked for the largest rehab provider in the whole United States. And so I would go to all these different nursing homes, hospitals, acute care hospitals, long-term care hospitals, all these outpatients and things like that. And I would go to where they needed me. And basically, it was where either clients weren't making progress and they were plateauing, or where business was really short, or the therapists were having a hard time identifying clients, or just knowing what to do with them. So they would call me in, and I would spend the week there. And during that time, I would consult on the clients. I would teach the therapists. They'd be sitting there right there with me while I'm working with the patient, and then um, have them do it. So there'd be a return demonstration, and so that the client would get better and they'd be able to go home. And then I would also spend that time doing some continuing education where I would provide courses that I would teach and things like that. And I loved it. And about 10 years into my OT practice was when I first got involved with Reiki. I learned Reiki from a Reiki master, and that just opened up the whole new perspective of what energy is and how
Mm-hmm.
it works, and how you can do distance healing, and how you can change somebody's energy just through either hands-on or from remote. And so that kind of opened up my eyes. Then I went into aromatherapy, then acupressure, then so it just started developing, and I started going to all these courses and getting certifications and things like that. And I started implementing that into what I was teaching through OT, through all the places that I've been going. I started bringing in, I really specialized in pain management. So I'd bring different modalities in from the Eastern world of medicine into the Western side and started to integrate those two. And when I started doing that, I started seeing a huge improvement in the client's outcomes, in how they were responding, in the healing process overall.
So you were
And then I,
using Reiki, and so, which is energy work, right? And you're using essential oils
yes,
and
yes,
acupressure. And acupressure is a form
hmm
of energy work in a sense, in that you are stimulating the nervous
yes,
system, but it's also you're stimulating the meridians, which is like more of an energy work. Um and you could even consider aromatherapy, although aromatherapy is herbal medicine. There is an energetic frequency component to it. So you're bringing in, along with your many years of experience in rehabilitation as an occupational therapist, you're bringing in this energy work and herbal medicine to your, is it the senior patients that you were working with already?
yes, yes, yes.
Wow.
And at the same time, I was teaching the therapist how to use this information. And see, when it came to the acupressure, I also used ultrasound, electrical stimulation,
Hmm.
infrared, all different types of modalities that we've always used in therapy, in OTPT. Uh, we've used those types of modalities in our practices. And so bringing those into the Eastern world as well was really nice, because a lot of people have a fear of acupuncture because of the needle.
Yes.
Whereas with ultrasound, you get the same result as if you were
Whoa.
using a needle.
Now, when you say ultrasound, just to clarify, and I apologize for interrupting you. The listener might not know this, but because you're on satellite internet, there's a delay. And so when we talk, there's a delay, and sometimes we sound like we're interrupting each other. So we don't mean to be. So when you say ultrasound, could you clarify? Because a lot of people think ultrasound is imaging, and not that it's actually using deep heat, or a wave of energy that creates heat in deeper tissue.
Yeah, so this is considered therapeutic ultrasound. It does not diagnose, like when people go in for a ultrasound to find out if they have a baby or not. So this is actually called therapeutic ultrasound. And there's two settings. There's a heating setting and there's a non-thermal setting. And the one that I use with the acupuncture points is a non-thermal. And
Ooh.
basically what it is there's a little sound, there's like a little crystal within the sound head that vibrates. And so it creates a frequency. And that frequency then interacts within the person's energy, and it gets the energy to flow through blood, through lymphatics, through the nerve system, through the muscular skeletal system, through all of those different systems, and it gets it to move. And so, how it works with the acupuncture point is that, when you use acupuncture, as in a needle, you have to be very precise where the acupuncture point is. With the ultrasound, because there's this sound wave that is vibrating within the sound head, when you get it over the acupuncture point, it will either flow into the body or release the energy from the point. And it's similar to when you're using a needle. You either tap it or twist it to get the result you're looking for, whether you're trying to push energy into that point or whether you're trying to release it. And so I use the non-thermal, which doesn't go deep into it, because the acupuncture point is so superficial to the skin that you don't have to go deep.
Fascinating. So tell us about these results that you started seeing, because you've got these clients. Have you been working with them for a while? You were traveling. So were you always working with new people, or did you come back to the same patients? And then what kind of results did you see when you went from just regular occupational therapy rehab to occupational therapy rehab plus energy work,
hmm
acupressure with therapeutic ultrasound, non-thermal, with essential oils? When you added those three modalities in, what kind of results did you start seeing?
Well, first of all, we started seeing results right away. I mean, during that session. And so what I mean by that is, and actually, because I was an educator for the company, I was able to go to so many different types of continuing education so I could actually open up my toolbox and have as many tools available to
Ooh.
work with clients as I needed. And it was wonderful. I got my myofascial release training. I got some cranial sacral, lymphatic. I mean, you name it. I was able to get all these different types of tools in my toolbox. And so I just started implementing them every time I would learn something and master it. And so when I would work with a chronic pain patient, for example, I'd be just into the facility for the first time, meeting this person for the first time. The therapist is giving me as much information. I read their medical record, and then I start to work with them with the therapist. And literally, I would say 98% of the clients that I got to see while I was traveling would show an immediate, if not significant, improvement within that first session, which is why it started becoming so popular for me to come to different locations and help some of the most sick or chronically disabled people. And then what what evolved from that was just an excitement within all the therapists that we have other tools that we can use, we have other theories, we have other philosophies that we can implement, and it also stayed within their scope of practice. So they were able to expand their scope of practice within their scope and get the best results that they could from their clients.
Can you remember a specific, um, early on, a specific client that had like this incredible before and after that you can share with us?
Well, is it with yes, for yes. It's actually happens to be one that I kind of reiterated in my book, but this was a gentleman. I want to say he was in Indiana, and he was there because he'd had a really bad stroke, and he was combative as well.
Mm.
And so when the caregivers would try to help him, he would just either strike out or just get really angry. And part of it was because his body wasn't working the way he wanted it to. And he would get really, really frustrated with it.
It also depends on where the brain damage is, because brain damage can cause that kind of erratic behavior and anger and outbursts just depending on
Hmm.
where the inflammation or damage is in the brain, right?
Absolutely. And within this particular situation, though, he was becoming more frustrated with the fact that his body wasn't doing what he wanted it to do. And he was getting like to the point where he didn't like his body anymore. And so he
Mm.
wasn't finding that he could even rely on it to do what he wanted to. And as a general, you know, he's used to commanding things and wanting things to work like they're supposed to. And so when his body was giving up on him, he was extremely depressed and frustrated and took it out on everybody. And so it was it was preventing the healing process of where he needed to go, and he wanted to go home. So they called me in, and I had the therapist show me exactly what they'd been working with him on, and I actually have a certification in what's called NDT, which is neurodevelopmental treatment, and it's a specialized it's a specialized process for people who've had strokes or any kind of neurological deficit. And so I went to go work with him. And while we're getting him to do certain things and perform certain tasks, he starts getting frustrated and he starts yelling. And he starts yelling at his leg and he says, "See, it's worthless. It doesn't work. It's broken. It's, I just don't need it anymore. Just cut it off." And I'm like, wait a minute, wait a minute. So basically we just stopped right there. And I just said, "I need you to repeat this phrase for me." And I said, "I want you to repeat, 'I love my body and my body loves me back.'" Well, okay, so imagine this general. He's looking at me like, "Are you crazy? Seriously?" So he, does this very sarcastic, "Oh, I love my body and my body loves me back." And I went, "Not good enough. Say it like you mean it." And he goes, "Okay, well, I love my body and my body loves me back." And I went, "Okay, really mean it." And I leaned into him and I looked him straight in the eye and I said, "Say it like you really mean it." And he literally started to cry. And he goes, "I love my body and my body loves me back." And I said, "Now let's do it." And we started doing the same exact task we've been trying to do over and over and over again and failed. And he succeeded. And to perfection. And he was like, "Oh my gosh, this is crazy. Can we keep going?" And I said, "Absolutely." So we performed that task over and over and over again, which is, of course, creating muscle memory and also decreasing the neurological exchange that's going on that was a deficit. And he sits down on the mat completely exhausted, and he's like, "You're a miracle worker." And I said, "No, you are. Once you started to believe in your body and to love your body back, it rewarded you back by saying it loves you too." And why I bring that up is because that's one of the things I've learned throughout the time that I've been an integrative medicine doctor as well as a therapist, is that it's the mind, it's the emotions, it's the psychological, it's the mental that gets in the way many times. And if we don't look at that whole person and address all of that, then we're not going to get complete healing. And you wouldn't learn that until you go through energy work, until you start to learn some of these different modalities and different methods to help people heal. We can't just heal the physical. We got to address the whole person.
That is so true. We cannot just address the physical. We can't just take our bag of symptoms to a doctor and get given drugs. Like, that's not healthcare. That's disease management. That's sick care. Healthcare is really holistic care, is looking at emotional, mental, physical, spiritual, and energetic, and getting that they're all connected and there's not one that's more important than the other. They all need to be addressed and they all affect each other. And that sometimes when we've tried doing physical, we're not getting results, then we need to look at energetic or look at spiritual or look at mental, emotional, and come in from that angle as well.
Yeah, his mind was getting in the way. And that's one of the things that out of, I would say, a good 85% of the clients that I see currently, truly there's an emotional and a mental deficit that is preventing them from healing. And part of that is the knowledge and the belief system that they can heal themselves, that they have that potential.
Right.
And
especially
in
if
the
they've been
medical
told,
field,
if
we
they've been
have,
told by an MD,
yes,
this is the way it is. This is as good as it's going to get. You know, you can't heal. I was told by an endocrinologist when I was 19 that I'd never have kids. Never. I was
yeah.
told by MDs that I would have diabetes the rest of my life. I mean, just I can't even tell you how many countless times I was told by medical doctors that I would always be sick. This is as good as it's going to get. We're going to manage your disease with drugs, and there's no hope of a cure, no hope of getting healthy. And if you believe that, then all your behavior is going to reinforce that. Luckily,
Well, and what I get,
I go against the
yeah.
stream. I'm one of those stubborn people, and I'm going to completely do the opposite. And so I was like, I'm not going to believe you, and I'm not going to let my unconscious mind believe you either. But we have to catch ourselves
I'm
and
going to
go,
prove you wrong.
right, but we have to catch our belief system
Absolutely.
and go, what is in my belief system that has me sick, that has me staying sick, or has me not looking for answers?
Well, and like I was saying, it's about 85% of the people who come to me, they come to me with, after they've been to every single specialist there is, and every single one of them say, "There's nothing wrong with you. So here's a psych eval. Go get a psychological evaluation because there's nothing wrong with you. We can't find anything wrong with you." And yet this is a person who is showing up with so many chronic diseases of autoimmune, of thyroid, of, lack of appetite, depression, anxiety. I mean, you name it. And then, of course, hearing that they don't know what's wrong with you only adds to the anxiety, only adds to the hopeless despair that is, being created. So I get a
Yes.
lot of that.
So people come to you after it's kind of like you're their last hope. And luckily you have a bag of
I
tools
know.
to address everything,
Yes.
all the different
Yes.
angles. And you have a lot of experience with working with, I don't want to say hopeless cases, but people who feel like hopeless cases, or people who the medical system has given up on them, or they've fallen through the cracks, or they're sick of being sick and they're sick of just being drugged and not and just having
Yes.
their symptoms managed instead of actually getting better, actually getting
Yes.
healthier. So, okay, so there you were working with all these tools, realizing that there was a psychological, a spiritual, and energetic component to rehab, to healing, in addition to all the physical manipulations that you can do to support people in their healing. What next? What had you? I love that Reiki was like your gateway into all this, because Reiki's awesome. I've been doing it since I was like at 16 years old, I think. What happened next that had you go fully into becoming a PhD in integrative medicine?
Well, the difficult thing for me was as an occupational therapist, you had to always have an order from an MD to do what it was that you wanted to with a client, with a patient. And when they don't believe in what you're doing, then oftentimes those orders wouldn't be approved. And so therefore you couldn't deliver it to that client or to that patient. And so if you say you want to do essential oils for pain management, they're like, well, there's no science in that. So no, we're not going to do it. And then, or there's no science in the acupuncture or acupressure or anything like that. And so we'd get turned down a lot of the services that we wanted to provide. And so that was very
Mm.
discouraging because I knew that these modalities would actually help these clients. And so when I would see that happen a lot, especially with particular physicians or something like that, I would always invite them to come and observe a session or let me teach you, let me show you exactly what this is about. Or I'd say, give me your worst client that you have, the one that you've either been struggling with for pain management or something like that, and just let me do what I do. And then you can tell me whether you find that this is valid or not. And so I started to see that, in fact, I'd have some of the physicians come and attend some of my classes, and they would stay afterwards, and I would show them because they'd say, there's no evidence that these acupuncture points exist. I said, yes, there is. And let me show you.
It's only a
Do you want to
5,000
feel
year
some?
old
And they're,
system of
yeah,
medicine. No evidence.
yeah,
5,000-year-old system of medicine. No
yeah,
evidence.
exactly.
Ah.
So I would hook them up with an electrical stim unit and allow them to feel the acupuncture points. And when they would be over an actual point, they would feel the intensity move up their finger as they're, you know, tracing the meridian. And when they would go over a master point, which is an extremely powerful acupuncture point, the intensity would go up even higher. And so then they'd be like, oh my gosh. And I said, follow that meridian all the way. And they would feel every single point. And then they're like, okay, okay, okay. I get it. I get it. Okay. Who did you want to see? And so they would start giving me the list. So that kind of got me to start thinking about what do I want to do? And it all started with my niece, who she was diagnosed with a very bad cancer, a tumor in her brain. And it had been misdiagnosed for almost a couple years. All they kept looking at were the symptoms. She was having pain in her head. She'd have weakness. She'd have some um, issues with cognition to where she would forget where her classes were, which when you've been going to school for a couple of years at the same school, you don't forget where your classes are. Um, she'd have hard time concentrating. She'd have some visual deficits and things like that that
Mm.
would just show up. And so they kept treating her as if she had allergies or if she had sinus infections or things like that. And they would just give her medications until the day that one whole side of her body went paralyzed. And then, of course, parents took her in, emergency room, instantly got a CAT scan, and they found a tumor about the size of a grapefruit in the back of her brain. So she instantly went in for surgery, and I loved her surgeon. This neurosurgeon was amazing. He had the best bedside manner. He was really, really good. And so she went through the surgery. They got about 98% of it out. And then she was a candidate then for chemo and radiation. They got enough of it out. but it grew so fast that she never got to have that. I mean, she did take some radiation and stuff like that, but the results, the side effects were so horrific that I
Of the chemo
started
and radiation?
doing the chemo and the radiation, and then all the other different types of, she was basically on every kind of trial there was to try to overcome it. And
Mm,
every single one of them just failed and made her feel worse.
yeah.
And she'd gained over 150 pounds because they put her onto a steroid, and that steroid just packed the pounds on her. And she
Mm-hmm.
basically became immobile. She basically was stuck in her bed for the last, I'd say 6 months of her life. And this was a very active, vibrant, vivacious young girl, and to see this happen.
Mm-hmm.
And so one of the things that I would go down to her house every weekend for the whole 2 years that she was sick, and give her mom some relief, and just have fun with her. And I would use some of my modalities. I would use some of the Reiki. I would use some of the acupressure. I would use some of the aromatherapy with her, and found that she was getting some really good relief. And, and she wasn't having the nightmares. She wasn't having the painful episodes, the difficulty with cognition, things like that. And it gave her some quality of life. And so that in itself told me that this was working. And so after she had passed, she did pass away when she was 18, and she actually passed on her mother's and my birthday,
Mm.
and we consider that her new birth. But that actually got me motivated to want to do more, and to use more of the holistic way of healing. And so I started looking for universities, and that's when I decided to go back to school. And I want to say I was what, 54 or 52 when I went back to school. And I thought, you're never too old to go back and get your PhD. Just do it. So I did. And I'm so glad I did.
That is so cool. And
Yeah.
um and her death and this her suffering uh at the
Yeah.
hand of the medical system showed you that you really wanted to explore tools that could have helped her.
Yes. And as a PhD, I don't diagnose and I don't treat. And I know that sounds strange. Then how do you work with clients? Well, I don't treat, because when you talk about diagnosing and treating, that's more of the MD side of things, the medical doctor side of things. When it comes to a PhD, I'm allowed to be able to identify energetic imbalances in the body that cause dis-ease, and then train the body, train the person on how to overcome those imbalances or those that lead to the disease state. And so I always make that really clear with my clients, is that they get a little confused with the treatment part. But what I'm doing is training the body to return back to homeostasis.
Mhm.
And training sticks, treating doesn't. Treating is really just treating the side effects, and it's really just kind of, like you said, a maintenance type of program. Whereas I truly feel that the training piece, which includes education of that client, which includes resources, which includes training the brain, training the muscles, training the neurological system to do what it's supposed to. And so as a result, as a PhD, I'm allowed to do what I want to with my clients. I don't have to have a physician's order to do what I want to. And that's what really drove me into the PhD program, was to be able to say what it is that I want to do with this client, and not have someone telling me I can't do this, and manage it.
Mhm.
And
So,
that's where the true empowerment came from.
so you in studying integrative medicine, you have many tools now. You gave me the tour of your clinic, and in this room, and in this room, and in this room, you have a lot of tools, and it's really cool. You can do work long distance with people, and you can also do work in person if someone wants to come to Republic, Washington, which is a beautiful place. Um, do you feel now that you have tools that could have helped your friend had she not chosen, I mean, this is all hypothetical, right? But had she not chosen chemo and radiation, Do you think you have tools that could have helped her?
That's hard to say because originally I didn't even know she was having any symptoms or anything going on with her until the diagnosis came. And at that point, it was so huge and so big at the time that it's hard to say whether I could have. Now, with the remote biofeedback, yes, I can work with degeneration, which is a form of the cancer, and the use of the modality. But I'm not sure if I can actually say that I would have been able to cure her. I feel sometimes we have to go through a process. I feel she was, I know this is going to sound terrible, but I think we had to go through this process with her so we could learn how to live, because that's the one thing that she taught us
Mm.
was how to live,
Mm-hmm.
how to live while you're dying.
Oh.
And she had this wonderful phrase where she said, um, she would always say that she had a really great sense of tumor versus sense of humor.
Oh my gosh. Oh gosh. Well, that's really
Yeah,
beautiful. That's really my mom passed away of
yeah.
cancer, and she did not do chemo radiation. She chose not to. By the time they found it, it was end stage. Um I guess she was just so healthy, and uh so sh- uh, when you look in naturopathic medicine, there's an idea that we have a strong vis, or a strong um the body has a strong will to be healthy. Some people have a weak vis, or their constitution is weaker. And those who have a strong constitution, which my mom did, unfortunately, those kind of people will kind of push their body to the point of breaking before they know something's wrong. And that was my
Mm.
mom. She was healthy, 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 dying of cancer. It was just like that, one or the other.
Yeah.
And it was Easter of 2002. So Easter came late that year. It was like late March. Easter 2002, she was having a pain in her side, went to her chiropractor because she thought she threw her rib out during yoga. She called me, and I was having the same pain. And I've got like that sort of intuition thing where, like, if someone's injured, I feel the, the pain in the same area.
Hmm.
And I was having the exact, I called my mom and I was telling her about my pain. She's like, I have the pain in the same area too, which is like the liver radiating. And she thought it was a rib. She goes to the chiropractor, and the chiropractor immediately sends her. I mean, he's such a good chiropractor, says, you are going in today for an ultrasound of your liver. Something's wrong. And she was in Florida. That she got an ultrasound, and that day flew to Ottawa, Canada, got into an MRI that night, and by that night was diagnosed with um, liver cancer. And so
Wow.
she passed away July 26th of that year. And so she was just doing some natural medicine, which the doctors actually think extended her life by a few months because of how bad how the size of the cancer um, was, and how it had metastasized to her lungs and her colon and all these other areas. So, but watching her go through that emotional process of knowing you're dying, and accepting it, and also living while dying, right? And so, yeah, I can understand that. There was a lot of sadness and regret, and also a lot of like love and surprise. And she couldn't believe how
Hmm.
supportive my dad was during that time, because my dad was always one of those people that's just like, suck it up. You're not sick. Stop telling your body you're sick. Suck it up. And he was by her bedside 24/7, and there's so much love pouring out of him. And my mom never in a million years would have thought that he would be so nurturing. And he's like, of course, like, this is real. He never wanted to give any mental power to feed into an illness. So when you have a fever, like, don't just tell your body you're well. That was his thing, like, mind over
Right.
matter. But she thought he would like just
Hmm.
tell her to suck it up. You have cancer, suck it up. And so it was just really funny watching that they actually healed their marriage. And it was really beautiful to watch that there was so much love and healing going on. So yeah, I can look at aspects of her final weeks and months, and see the emotional beauty in it, right? Like, we're all going to die. And if we can
Right.
gain if we can gain those lessons, those learnings, if we can spread that love, then that's beautiful, right? Um,
Well, she also knew where she was going as well. She had a very strong belief system, and she was able to
mm,
share with me what it was like, what she was where she was going. And so that also gave her some of that comfort as well,
that's beautiful.
and that strength. And what was so beautiful was just that she maintained her humor through the whole thing. She would make us laugh even when she was hurting. Um, she also helped me understand how I can help others when they're going through that process as well.
Oh,
And everybody has a to-do list, something that they've wanted to accomplish, something that they wanted to get done. And so that was my job, was to help her with the things that she needed to accomplish before she passed. And one of those was we wrote letters to every single one of her family members that she wanted to leave information to, her friends, and so on. And so when she was having some of those lucid moments where she could keep some make some really good language and express what she wants to, I wrote so quickly what it was she wanted them to hear and say, and kind of her last memories of them, so that on the day of the service, that I was able to give those letters to each of these individuals, which was one of the greatest gifts that she's given to any of them, because she lived on. We recorded every session that we had together. We videotaped things, just so that we could share the memories. And she has
oh,
two younger sisters that are twins. And so I interviewed her as if, you know, for all the moments that she was going to be missing, like prom and graduation and things like that, that the kids would be involved in. And I said, okay, so the twins are getting ready for their prom. What's the day like, and what are you guys doing? And so I recorded that so that they could have that memory too,
oh,
because I know it's not just us that's losing this wonderful person, it's the family too.
yeah,
So she got to live on,
that's
and she still does.
beautiful. And really healing is
Yeah.
about not just our body. We're not just a meat sack. Like we have to look at
Yes.
the impact we have on others and our family and and going beyond that, right? And so that's really beautiful to take into account as part of healing, to take into account those around us that both impact our life and that we impact their lives. God, I love that. I love that idea of recording for future events. That's really beautiful. So, what
Yeah.
about what comes to mind is Dr. Hammer's work with meta medicine. Um, where do you stand on that? After I'm sure you've studied that as one possible way of understanding cancer. Um, where do you stand on that now as a perspective with your experience with your friend who passed away of brain cancer?
Well, I truly feel like whatever the body creates, the body can heal. And so when we have a virus such as cancer that invades our body, I truly feel we can heal it. And it's on the way in which we approach it.
Hmm.
And like with her, with my niece, the way we approached it was the way that she was able to manage some of her pain, and also to try to decrease that tumor as it was starting to grow, is we started using visualization techniques where I said, okay, act like it's a Pac-Man, and that Pac-Man is eating that tumor. And she goes, and she try it, and then she goes, yeah, it doesn't work. And she goes, well, I said, what would work? And she goes, how about Alka-Seltzer? And I'm putting this little Alka-Seltzer tablet in a glass of water, and it's just sizzling, and as it's bubbling away, it's destroying the tumor. And I said, go for it. So she was even using a form of meditation at that point. And I feel like when we can actually identify that there is something foreign in our body, because we all know we have cancer that resides in our body, it's just not active at this point. And so when we identify and it's starting to show some symptoms that we do have it, then let's destroy it through our body. Let's identify it and use all the means we can. And so I feel that that's where this integrative medicine comes in, is identifying it, using the body's potential to heal itself, and to um, get rid of it. And some medications will work. I agree that there's sometimes that we do want to use medications, and that would be in the acute episodes of a distressful situation, such as heart attacks or high blood pressure or something like that. Get people to a point where they're stable, but now we got to take them off the medication, and I think that's where we are uh, not really doing what we need to in the medical field right now, is getting people off the medications that got them to a point where they're stable. Get them to a point where they're able to manage it through their diet and do these drastic changes that need to happen in their lifestyle changes, and then let's get to work. But get them off the medications because we're not designed to be on them.
Yeah, no kidding.
Mm-hmm.
I know cancers are real, it's a tough one because if we're looking at everything that led up to it, the terrain of the body and the years it took. You know, there's holistic doctors that are like holistic oncologists, naturopathic oncologists, and they say it can take somewhere up to 8 years before it actually appears as a tumor, right? So some cancers and some forms of cancer, it takes many years to get to the point where the body has gotten sick enough or worn down enough or toxic enough to create that cancer, right? And there's different schools of thought, like with Dr. Hammer's work, the belief that it's an emotional event so jarring that the person could not comprehend or overcome it, and it becomes the body's neurological and hormonal response to a major emotional event, which he did over 30,000 um, case studies on, and was able to actually help some of those people reverse the cancers by working on the emotional component of what triggered it. And then there's I'm sorry, I'm having a brain fart. I interviewed him. I'm having a brain fart of his name at the moment, but he amazing, the last name is Simoncini, Dr. Simoncini, in Italy, says that he believes all cancer is a form of candida, basically. And he's been able to, with over 70% success rate, kill tumors, even brain tumors,
Mm-hmm.
by making and this is a great interview to listen to, by the way, for anyone who wants to listen to something just totally freaky. He creates a port, um, he's a surgeon. He creates a port going into the vasculature that feeds the tumor, and then makes a solution of sodium bicarbonate, which he says everyone knows, like everyone knows this. Everyone knows that's how you kill candida. You kill yeast with with a very
It's true.
yeah, you kill it with the sodium bicarbonate solution. And so he would just basically mix these two together in a very specific solution and pour it into the tumor, which it's not going to damage the body. The body just has a buffer system to bring up the pH, or up or down the pH as needed. But he pours this into the tumor, and most of the time that day or within days, the tumor is dead, gone. Um,
Yep.
and so he has over 70% success rate, which means maybe in some cases it's not candida, right? But we're looking at this for these holistic doctors who have exceptional results with cancer, that on some levels there's an emotional component and people's cancer goes away after that. On some level, we've heard of some people who had like skin cancer just completely fall off and go away when they used a concentrated form of cannabis on topically, right? So we hear these
Yes. Rick
things.
Simpson.
Right,
Yeah.
yeah, Rick Simpson oil, and there's some great videos that are like 15 years old on YouTube of Rick Simpson talking about or 12 years ago.
Yes.
Um, so it's all fringe, because of course, with the way our medical system is now, the only acceptable form of medicine in the United States and in many other countries that follow suit is surgery, chemo, radiation. But if we go to Europe,
Yes.
they actually, a standard form is also used. In addition to those, they also use hyperbaric chamber, ozone therapy, and uh, hyperthermia. So those treatments are not allowed to be used by oncologists here, but are regularly used by oncologists in Europe with success. And then we have the more fringe stuff, right? Like Dr. Simoncini putting sodium bicarbonate. Can you imagine if all the oncologists in the United States just started off by using sodium bicarbonate solution directly poured into the vasculature of the tumor through a port, just to see if that could kill it first? Like, how much, first of all, how many lives we could save, how much money uh
Yeah.
the pharmaceutical companies wouldn't make,
Hmm.
right? So
Right.
unfortunately there's that money component. But looking at this,
Yes.
there's also a belief that tumors are related to parasites. Just this summer there was some great research that came out where they were able to isolate the microbiome of tumors, and they discovered that specific
Hmm.
tumors have a different microbiome than the rest of the body. And now they've started creating diagnostic tools that they can actually detect either in blood or saliva the microbiome of tumors and specifically identify before the tumor ever shows up as big enough to show on a scan. They'll be able to detect the tumor because the microbiome, which then leads us to think the if the body is so out of balance that it has these
Hmm.
kinds of bacteria in it, right? Like the bacteria is like the body's like a petri dish, right? It's gonna give these bacteria, right, the bad bacteria, a home. Is that the cause of the cancer, or does the cancer itself then create? So like what happens? Does the cancer create the microbiome? Does the microbiome create the cancer? So there's so much to explore here, and we're really limited in the holistic space because we're up against the pharmaceutical industry that really wants to protect its dollars. Um, but
Yes.
we have to be open-minded. So you have at your fingertips the tools that support the body's ability to come into balance, and you can work with nutrition, you can work with energy, lifestyle changes, detoxification methods. Your whole thing is not treating the disease but actually just supporting the body's ability to come back into balance, because if the petri dish of the body is so healthy, it cannot support the candida, it cannot support the parasites, it cannot support um that disease from living in it. So this is where we are. We have to kind of rise above the pharmaceutical philosophy, and where that they're just treating symptoms, and come at it from your perspective. So since you graduated and you became a PhD in integrative medicine, you've been working with all kinds of amazing clients, doing this kind of therapy. Um, what have you been really happy to achieve? And I know you don't do the work, the person does the work. I get, like, you're not treating them, but what are you really happy with the results that your clients have received? What are you really, really excited about?
What I'm excited, well, first of all, to go back to what you were talking about, I agree with everything you said about the emotions, about the bioterrain, about parasites and candida. I have found that candida has been a leading cause of many of the people that I see related to cancer. And we started working on the um, getting rid of the candida, and through diet and through different supplements and stuff like that, as well as through detoxing, and found that they started to show a decrease in those symptoms as well. So I agree with everything you said. Louise Hay actually talks about how emotions have a huge impact on our disease process, and looking at some of the unresolved emotions that may be leading to those diseases and causing them. So that's one of the things that I always recommend to my clients, is that they read that book, for example, because
Mm-hmm.
oftentimes there is an unmet emotion or unresolved emotion that is causing some of this dis-ease in their body. So, but to get back to your question, yes, I have these resources that are available, and I love it. But what I love the most about what I'm able to provide to my clients is giving them their power back. And what I mean by that is giving them their power to heal themselves, to know that they can, to love themselves again. That's a big one. And to resolve some of those hurts, and to realize that we don't have to always look for other people's approval of who we are, what we've become. It's really only our own approval of what we're doing, who we are, what we want to become. And I think because of the advent of social media and how much social media people are involved in, and just media in general, is we've given our power to so many other people that now they own our power. The medical
Mm.
industry, the pharmaceutical industry, they own our power because they basically say, I can't heal you unless you take this. Or I don't know what's wrong with you. So therefore, you need to have a psych eval or all of this. And yet the power is within. We just have to help them find it.
Mm-hmm.
And so that's what I love. When I see my clients say, oh, aha, or they have an aha moment, or they go, oh, so this is why. And then they resolve it and they're like feeling so amazing. And all the symptoms that they were having is gone. And they're actually having a joyous life. And then they're like, is this supposed to be what it's like? I suppose, because they've been living in this world for so long of lack,
Yeah.
of, feeling that they're not worth it. Or one of the questions I always ask is, what do you love about yourself? And if it takes 10 minutes to come up with one thing that they love about themselves, we need to work on that self-love first,
Mm-hmm.
because healing will have a hard time happening if you don't love yourself. So
Brilliant.
that's what I like the most, is what I'm passing on to most of my clients, is that ability to love themselves and knowing that it's okay to do it, that you don't have to do this brainwashing, and really working with the children now too. I am working with younger children and helping them realize that to love your body and to love your mind, love who you are. Don't let others turn you into somebody that you aren't because of getting their approval, or wanting them to be liked or something like that. Um, just shine bright, and live very comfortably in that light.
Can you share with us some specific results that clients have achieved through working with you?
Well, how long is our show? um,
Stories of success, like any just that come to
yeah,
mind that you want to share.
yeah. Well, I actually have several. So, um, well, one of the first ones is a lady who had come in to see me mainly just because she just wanted to feel better. Really had no real specific illness or anything like that. Just didn't feel quite herself and just wanted to feel better. And so as I'm doing my assessment on her, and I'm reviewing her symptomology and the things that she wants, one of the first things I always ask is, can I look at your tongue? And so as she's sticking her tongue out, I notice that half of her tongue is paralyzed. And I'm like,
Ooh.
interesting. What happened here? And she goes, oh, I had a surgical procedure. It was an endocarotectomy, and they nicked a nerve. And basically, this half of my tongue has been paralyzed ever since. And I said, well, how long ago was that? And she goes, about 3 years ago. And I went, really? And it hasn't regenerated. And she goes, no, they said basically there's nothing they can do. She'd gone to speech therapy, she'd gone to different things, and nothing changed. And I went, huh, okay. And I'm thinking to myself, I'm going to look at that and see if I can address that with my biofeedback. And so I did. And I worked on her for a total of 3 sessions. And after the first session, she came back the next week and she says, is it my imagination or is my tongue getting better? And I said, well, let me look at it. So she sticks it out and there is some movement. So I'm like, it does look like it's getting better. But I didn't want to give her false hope. So I said, well, I think there is some improvement. And so I worked on her again. And the next time she comes back and she goes, oh, there's definitely some improvement. And I said, show me. So she shows me again. The last time I saw her, um, she had full function of her tongue.
Yeah.
And the one thing that we were working on was the slurring of the speech, because as a result of the tongue being paralyzed for so long, she had developed these behaviors or these patterns within her speech where it would come off as slurred speech. So she sounded like she was always drunk. And so she had called me one day and left me a message and said, you're not going to believe it, but now I have full function of my tongue. I actually got to eat a hamburger for the first time without having to chop it up into little bites. And she said, and I didn't have to take my finger and sweep the inside of my cheek to get the pocketing of the food out. I was actually able to use my tongue. And she said, now when I speak, people don't think I'm drunk all the time because I'm not slurring my words. And so when I see her in town, I'll ask her, I'll say, stick out your tongue, and she'll stick it out very sassily, like, with a lot of, flair, because she can, and because it's working. Now, did I anticipate that that would work or that I would see an improvement in that? I didn't. But the belief system, is a strong thing. And sometimes we're giving miracles like that. And she was one of those miracles where I really didn't, I really didn't think, I mean, not that I didn't think it would work. I was just keeping it open,
You didn't
letting
have
the
any
universe do the work that it
expectations.
needed to.
You didn't have
Yeah, that was the word I
expectations,
was trying to find.
but your the way you do the biofeedback, which you can do in person or remote, which is my experience, the remote worked.
Hmm.
um, that it's helping whatever the body needs to correct. It goes through every system of the body, and whatever the body needed to correct, it does. That's really, it's so interesting. And working as so I'm a master practitioner and trainer of neurolinguistic programming, and I've seen
Yes.
people my teacher worked with a client who was in a fire and had half of his face was scars, and he did emotional work called timeline therapy, where he healed from the emotional scarring of those events, and the man's skin, this is years before, right? So he had, like, the doctors are like, you will always have a disfigured face, you always have these burns, the scar burns. But
Yeah.
what I think is really interesting is, how does the skin remember to keep creating scar tissue, right? And I've taken anatomy, like, in college. Like, I understand there are layers of the skin, and you damage it, the layer deep enough, like, you damage that third layer and you're done. You've always got a scar, yada yada. This is what the medical system says. But the
Yeah.
body has to keep creating scar tissue, right? Because we constantly are shedding skin, right?
Yes.
So the body has to remember to not produce healthy normal skin, and instead produce a scar over and over and over and over and over again, long after the scar isn't needed anymore. The scar isn't needed, but the memory, the body keeps doing it. And this is what I think is funny, because we've learned now in more recent years that even adults have stem cells. So if our body has the ability to produce stem cells, we can recreate healthy skin. Like, what's going on? But there's a belief to hold on to scars, right? And so after he did this emotional work called timeline therapy, which I'm a huge fan of, and also a master practitioner and trainer of, um, his face started having the scar dissipate over time, because it takes, a few weeks or whatever for new skin to rise to the surface, and he no longer had the scars on his face of the fire. And that's just one example. There's so many other examples where
Yeah.
or stories where the body, once the emotions are healed, the belief system's changed, the body follows suit. And for your client, it's like, was the nerve actually damaged 3 years later, or was she holding on to the body on an energetic level is holding on to the memory of the injury and continuing to
Hmm.
to um perpetuate the injury into the future. Which, and you've seen this in
Right.
occupational therapy, because people will hold on to a holding pattern in their gait, and you watch them walk in their gait as they walk away and towards you, and you'll see where the body is holding on to an old injury or compensating for an injury that's no longer there. Z Health
Yes.
is a great form of medicine designed by a chiropractor, where you um wipe away mentally, by working on the the nerves in all the joints. You kind of like wipe the slate clean, so your brain resets back to normal. And I've seen people who have been holding on to old injuries, after doing even one session of Z Health, walk differently, move their body differently, like, more
Yes.
freely. And so there is, again, you cannot separate the unconscious, the mind or energy or energetic body. You can't separate that from the physical. It's all connected. But how much of our illness is being perpetuated by our belief system? How much of our illness is being perpetuated by a memory that our body has to continue to hold on to it? Right? And so I love the work you do because
Well,
you're resetting the brain, you're resetting the belief system, you're resetting the body back to homeostasis.
well, and it's also finding out, how does this disease serve this person?
Mm,
That's one thing that is a hard question to ask, because most people will say, "What are you trying to say? That I'm coming up with this on my own and that I'm manifesting this?" And I said, "Well, let's talk about that." Because some of the really big breakthroughs that I've seen as well with clients is when you realize that they have become their diagnosis, and now they associate themselves with it. So, for example, I learned this in some of the work with Dr. Joe Dispenza, when we keep referring to our diagnosis of, let's say, fibromyalgia, and he calls this the water cooler conversation, when all the people at work get together and they start talking about their weekend and they're standing at the water cooler. And everybody will be talking about the fun that they had. And then you have that one person that says, "Well, because of my fibromyalgia, I wasn't able to do this. And because of my fibromyalgia, I wasn't able to do this. And because of that, I wasn't able to do this." And so basically, they're making their fibromyalgia much more stronger in their body. And
mm-hmm,
it's wherever you place your focus, you place your energy. And so the more energy they put towards that fibromyalgia, the more symptoms that they would have. So then you have to ask, what do you gain from telling people you have fibromyalgia, or even acknowledging that you have it? What's the gain that you get? And oftentimes, and this is where I've seen some huge breakthroughs with my clients, because that's a question that's really hard to ask, because then they have to ask themselves that same question about, what am I gaining from it? And in many of the cases, what they're getting is the attention from people. They're getting the love from, let's say, a spouse, that because you have this pain, I'm going to take care of this for you, or not having to do the housework, or not having to do this or what. And so internally, there is a return on that investment of the fibromyalgia. And so once you can actually identify, and I'm not saying this happens with everybody, but in some of the most chronically conditions that I've seen, where it's really been debilitating, when we can do that level of work and get that acknowledgement, or even who hurt you when you were a child, or going to the ancestral piece of healing, and going back to that child and healing the child from all these traumas that they may have experienced, that now is starting to manifest as an adult. And when we can go back and do that, then you actually, that's when you get that aha, you see it, and it's like, wow. And then they come back and they say, "You're not going to believe what happened. I went a whole week without any pain because I didn't need it anymore. It wasn't serving me anymore. I didn't need it anymore." And that's a beautiful thing.
fascinating. So you've worked with people who have the symptoms of fibromyalgia,
Yes.
and you get them to
I
a
work with
point.
all different types of pain.
Oh, yeah, absolutely, I bet. But but specifically, fibromyalgia is very invasive. It's um
Hmm.
man, I have a friend who had, she showed me, like, this was, I don't know, 10 years ago, 12 years ago. She showed me two drawers in her nightstand, two nightstand drawers full of meds for to manage
Yep.
her fibromyalgia. And she also had I think it was a morphine pump. She had some kind of pump attached to her body that would constantly
Hmm.
drip a pain medicine,
Yep.
and I think it was morphine. Um, and I was talking to her about nutrition and how Dr. Wallach, who's one of my mentors, says that fibromyalgia
Yes.
is a nutrition deficiency, largely mineral deficiency. And a lot of times, even just incorporating selenium really helps. And I talked to her about, wanting to get her on all 90 essential nutrients, vitamins, minerals, amino acids, fatty acids. And so I think she just went out to any old store and bought selenium. Like, I don't even know if it was a good quality selenium or whatever. But she got on it, And I was talking to her like, okay,
Mhm.
please take some vitamins, take some minerals. I was showing her the ones that I've been using for the last 10 years. And she reported to me that she cut her pain meds in half, like literally an entire drawer, nightstand drawer is gone
Nice.
of meds. And that's just by incorporating one of the 60 minerals that the body needs. Um, and that just goes to show. Now, of course, you have to look at the mental and the emotional component and the spiritual and the energetic. You have to look at everything. But man, if you can have just a little, like that much leeway, like cut your meds in half by incorporating one mineral, like you think you'd want to like, that would be the gateway. Like, okay, I'm all in. Let's do holistic medicine. Let's see how better I can get. But when we have a secondary gain from a disease, like if it really is on an unconscious level giving us something that we're lacking, right? Then we're not really motivated to
Mhm.
fully heal it. Because maybe it's part of our identity at that point,
Well,
or
and
maybe it's how we compensate for wanting love or attention.
I actually got to see this with my dissertation that I did for my PhD, and that my topic was on chronic pain, and I was using ultrasound over acupuncture points as my intervention, and I was using QEEG, which is qualitative EEG, to map the brain prior to the intervention and after the intervention to see how would the brain change as a result of this intervention. And so I would do the EEG first and see where the pain manifested itself in the brain based on the brainwave activity. And then I would do the intervention. And the intervention was based on whatever their pain, where it was, and everything else. And I used the same 5 points with each of my clients, and then I used 5 different points based on their specific level of pain. So then that way I could do a really good analysis of how the points work. And every single person in my study showed a significant reduction in their pain just from one session of the ultrasound over acupuncture points.
Wow.
But what I did find, and I didn't, I mean, I was expecting to see this, but I wasn't sure if I would, is that the people who had an emotional attachment to the pain, and what I mean by that is whether it was brought on by another person's like an accident or an injury or let's say a physical abuse of some sort, if there was a huge emotional attachment to it, the pain symptoms went down, but the pain response moved from the sensory motor cortex of the brain to the emotional part of the brain.
Wow.
And that showed me how strongly the emotions hold pain in the body. And
Yes.
that also opened up a whole new avenue for me to address pain and really look at the emotional attachment to it. The ones that had no emotional attachment to the pain, their pain completely went away. So that showed me, first and foremost, that this intervention works. The second thing that was a wonderful experience was to see how the emotions have a huge impact. And that's why when we're giving pharmaceuticals, why the pharmaceuticals don't work. And when someone who is in so much pain wants to get an increase in their pharmaceutical medication or another one, and they're being considered a drug seeker or something like that from the pharmacy or from the physician or whomever, it's because we are not actually getting to the root cause of the pain. We're just covering it. And it's up to the practitioners to identify that. And we haven't. And that's where we're failing our clients. And when I saw this study, when I actually saw it with my own eyes, I was like, I looked at pain in a whole nother way. And that in itself has helped so much with my clients getting better. Because one of the things with the biofeedback, when I am assessing somebody on that, it will always bring an emotion to whatever we're looking at. And it's a subconscious, unconscious emotion. And when I see this emotion come up, I'll ask them, so this is showing a resistance to change. Let's talk about that. And they're like, oh, yeah, that's totally me. Or that there's some anger or frustration or anxiety or something associated with it. And let's talk about that. Let's resolve that so that this condition has a better potential to heal.
Oh my gosh. Your PhD dissertation sounds amazing. What an incredible experience to actually see that um, for those who were holding on an emotional level. The pain was there, physical pain was there actually because there was emotion around it. Um,
Yes.
yeah,
Yes.
and that you could actually see it move into the emotional centers of the brain. Were you able to help those people? Were you able to, did you work on
Yes.
healing emotions, and then did
Yes.
you see in the
Yes.
in the brain scan that it was gone?
Well, for the time of the study, I didn't get to actually do any additional testing afterwards
Mhm.
because I was leasing the equipment and it was quite expensive.
Yeah, I bet.
So I was only able to do that one. But when I was able to share the results with these individuals as far as the emotional component to it, then that actually started the work of the healing, of really identifying that when it came to that. And the ones that had the healing from just the points and no emotional component, I just showed them which points to use and how to press on those points and to help relieve their pain if it should ever come back. And that gives them their tools as well. There gives them their power back. But yeah, we did address the emotional piece to it.
So I did this really interesting interview. Normally I don't glorify pharmaceuticals, as you can imagine. I did this really interesting interview with a psychologist who works with ketamine and on a for healing emotions. Um, he has a clinic that is has an incredible success rate. Like I think it's over 70% success rate in helping people with addiction. Whereas I think like Betty Ford, for example, is like, 30% or less than that percent success rate, like in terms of people quitting alcohol or drugs and then never getting back on them. And they have an incredibly
Hmm.
high success rate. And that's because the ketamine, much like LSD, but half the shelf life or half life in the body. So like LSD, I don't know, maybe you're like tripping for 12 hours or something. Whereas ketamine, they can dose it. So you're only like in that state for about 4 to 6 hours. And then during that time, they do therapy. But what it does, and these are people who have huge emotional wounds, right? Like that they like people who've come back from
Yeah.
war, they have post-traumatic stress, they've been in abusive relationships, like they're using substances to just numb and cope with the horrors that their brain keeps reliving. And the ketamine allows for like LSD, and they've done studies on this for many years, but it allows for, and also microdosing psilocybin, magic mushrooms. Some psychologists do that as well, but it's all
Yeah.
they all pretty much do the same thing where it has the critical faculty melt away and allow us to gain the positive learnings from those experiences without being triggered and traumatized while working through them. And what's very interesting, so this doctor has a clinic and he's working with the ketamine into basically the gate, helping people open up so they can do the therapy, and then they really get to the root cause and they have incredible results. But he himself had chronic for years shoulder pain that was debilitating shoulder pain, and he did not want to be on he didn't want to get addicted to pain meds. And it was because he tore a bunch of stuff in his shoulder from martial arts years before, and he kept re-injuring it, and it was just a really messy deal. And he did one dose of ketamine, and without any therapy, just one dose of ketamine, and the pain went away for like 6 months. One tiny dose, and then like he says,
Hmm.
every 6 months he takes one. He like a micro dose. He takes a micro dose every 6 months. But it's interesting because he said some people get emotional healing by themselves. They just do this one dose of ketamine, and then and of course this is all in a therapeutic setting, because you can't just, they take away cell phones, they don't have the TV on, there's no magazines, there's no books, um, because your mind is open now and anything can come in. But some people go through huge healing just by being in that state and working out stuff, working out stuff
Hmm.
on their own. And that's what he did. And he sees that there's
I love
this,
it.
yeah, but he has had people who no longer have post-traumatic stress, no longer have major psychological episodes, and no longer have addiction. And the side effect of this treatment is also people who are in chronic pain for years no longer have chronic pain. So again, I don't love to glorify any kind of medication, but they're tools that we can use when we need it. Um, but looking at that, that was like it sped up the process so they could actually do the emotional work, and the emotional work
Mm-hmm.
was able to then have them no longer have chronic pain, post-traumatic stress, anxiety, fear running their life, and substance abuse, which is fascinating. And so if we can heal and really acknowledge that our pain and disease can be at the root in the emotional centers of the brain, and that when we work
Yes.
on that in conjunction with eating a healthy diet and all those other things to just support the body as a whole, but that acknowledge that mental emotional health is incredibly important, and that we can address it with these amazing technologies like remote biofeedback, which is really cool.
Mm-hmm. Mm-hmm. Well, actually, I learned a lot from this one client uh, pertaining to this particular topic, and as we were doing the emotional work when it came to her pain level, she was basically saying, I have all these friends and family that never come to see me. She goes, but the pain is something I can rely on every day.
Wow.
That will come.
Whoa.
And I was like, yeah, exactly. I had the same response. I was like, wow, that really showed a lot of work on her part to acknowledge that, to notice it, and then to say, this is why I have it. This is why I keep it, because it's the one thing I can rely on every single day that will show up at my door is pain.
Oh my
And I never
gosh.
looked at it that way, but that was quite mind blowing for me. And so pain had actually become her friend. And so it made me look at it in a different light. And then we just needed to identify something else. And that was really her own sense of self worth. And that you don't need outside people to provide you the love and all of that. Let's work on the love inside. And let's work on that own self esteem, that self love, to where you don't care if people call you or want to speak to you or whatever, because you have the joy in your heart. You have that joy. And but that was kind of an aha moment for me as well. So I love it when I get to learn from my clients, because I feel like every opportunity that we are with clients is a learning opportunity as well, as far as how we can help others, as far as how we can help even ourselves in our own personal life. So that was pretty profound for me to hear that.
That's amazing. I'm kind of still blown away by your work when you did your PhD dissertation. Just what an
Yeah.
incredible experience, and also to then turn around and show the client, like, see, here's your brain, here's where
Hmm.
the chronic pain moved into this emotional centers. Because oftentimes, especially like I know several people with chronic pain who there's no medical reason for it. They do scans. Oh,
Hmm.
there's nothing there. There's no medical reason for it. Go for a psych eval, whatever, right? Like they just get on stronger and stronger pain meds, which the body adapts to and can basically override.
Yep.
And and the medical system doesn't have an answer for them because they don't see anything on a scan. So when you show
Right.
someone, like, here's your pain in your brain, here's the pain, and look, it's moved now because of the acupressure. Now, like, here's the root of it's actually over here in the emotional centers, and you show them, you're sh- you're you're
Hmm.
you're showing them, like, first of all, you believe them. There's actual evidence. There's a reason for it. You're not crazy.
Yes.
It's not all in your head. It's in your brain, but it's not all made up. This isn't, so
Hmm.
um what it's very validating. Um, I just remember feeling so
It is.
sick for so many years, and the doctors really not having any answers for me until I went to natural medicine. And it was very validating 12 years ago when I went to a holistic, she's an MD who actually gave up her MD-ness when she, like, gave up her license when she realized she was just a drug dealer, and what she really wanted to do was be an integrative um functional medicine practitioner, and really ahead of her time. And she showed me. in labs that no other MD had drawn, because they all said, okay, there's nothing really wrong with you, go, whatever. And she showed me in labs like why I was so sick, and that I needed natural medicine to get better, and she showed me that path, and that was so validating. Like, oh, here's why you can't get out of bed. Here's why you are so tired. Here's why you are like the walking dead every day. And she showed me on those labs, and she could validate it instead of all the other doctors that basically just wanted to put me on drug after drug and said there was no evidence for it. So um and then natural medicine got me well so fast that I dedicated my life to wanting to share this information, which you have as well. So helping someone who has been suffering for years to show them that their suffering's valid, it's real, and then help them heal from it, and then help them come back into balance. Can you tell us more about
Yeah,
the remote biofeedback, specifically the SCIO, the work that you do? Um, how does it work? Or can you just walk us through or paint the picture so we have a deeper understanding of it?
absolutely. Well, first of all, I have the pleasure and the leisure of being able to have as long of a session with the client as I want. And so my minimum amount of time that I spend with a client is 2 hours. And that's almost unheard of these days. But in that 2 hours, you get a lot accomplished. And, you know, what I see is that most of the time, within the first 15, 20, 30 minutes, the client is just getting warmed up. And what I mean by that is they're just getting comfortable with someone actually sitting there listening and actively listening and hearing what they have to say and believing in what they have to say as well. And validating, kind of like what you just said, validating that their symptoms are real, that they're not going crazy, that they know their body better than anybody else, and they know when it's not right. And so intuitively, they know there's something wrong with their body. So for me to be able to spend the 2 hours that I want to with a client allows me that opportunity to really get to know them, not only the emotional, but like you, I do the neurolinguistic programming as well. And I look for that nonverbal language that's telling me things that they're not ready to tell me yet,
Mm-hmm.
but their body's telling me. And so that helps me identify areas to look into when I go into the biofeedback. So the way that the biofeedback works, especially remotely, is they send me a sample of hair or saliva and a questionnaire that I sent to them to complete, that I can actually then enter that data into the computer. Most of the time, I like to have them on the phone with me on a Skype or in other means so that they can also see the same screen that I am using with the biofeedback, because I feel education is so important, and
Mm-hmm.
especially educating them as to how their body works and how it responds, and looking at it in a different perspective, not as a computer, but as that this is a live being that is full of emotions and psychological issues and so on. So the way that the biofeedback works with the hair sample, it's not a cut sample. It is actually a hair that is pulled from the scalp that has the root ball. Because anybody who's ever had a hair analysis, you want to pull the hair and get a root ball because that's your DNA. And so it reads your DNA. And so similar to like a cell phone, with a cell phone, you have a specific phone number. So you can be anywhere in the world and you can be located. That's how this biofeedback works. When I put that hair sample or the saliva sample on the SCIO box, it has this metal plate on the top that reads things. So if somebody wanted their water tested, for example, they just bring in a water sample and I place it on the box and it'll read their water to tell me if there's any pollutants in there that is not working for them. It's kind of going against their own constitution and things like that. If there's any heavy metals, things like that in there. And same thing with their hair or their saliva, it reads it. And so then it's being able to then to find them wherever they are in the world. They can either, like I said, be on the phone or just be completely laying on their couch with no connection with me whatsoever. It's still working. And so like the phone, it picks up their frequency, their vibration, and then it reads it. And so on my computer then, with the SCIO, it's reading everything energetically, from the lymphatic system to the blood to hormones to scanning the spinal, the spine, the nerves, the cranial nerves, teeth. I can actually do a dental assessment to see 5 different areas of decay and things like that that's going on, which is absolutely amazing. And the chakra systems, the auras, I mean, everything. Literally, I don't know if there's anything that I can't touch at this point. And it reads it. And then as it's reading it, it does a 3-minute assessment, and then it comes up with this record. It's literally 10,000 options of symptoms, as well as trainings that you can provide to that client. And then it grades it on a scale of, the most acute to the next acute to the third and to the fourth, and then what's considered chronic, maybe hanging around for a while and undetected. And that's where I find a lot of things that has not been detected by the medical side of things, because all the symptomology is taking all the attention, where the root cause is kind of sitting behind the scenes. And so that's typically where I'll find where some of the root causes of their disease process is at. And then we look at it all. It'll tell me allergies and sensitivities. It'll tell me if they've got parasites, if they've got worms, if they've got pathogens of some sort that is causing this disease. And then we start identifying it as a team. And what I mean by that is I say, what is on this screen that you'd like to look at further? And then I educate them as far as what it's doing, how is this working? And then as we identify, then I can actually test each particular area even further to see just how reactive their body is to that particular thing. And that's when it actually will show me what it's linked to. Is it linked to blood? Is it linked to the liver? Is it linked to organs? Is it linked to, and it'll also give me an emotion that it's linked to. And then, like, for example, if it's a parasite, then I'll say there's this one particular parasite, it's taking a while to rectify. And what I mean by rectify is that rectification means that you've been able to switch the energetics of that particular thing to where it's no longer reactive in the body. And so once I get it to this rectification, then we move on. But prior to that, that's when I can actually test it individually to say, what else is going on? And that's when the emotions will show up. And I'll say, okay, there's this emotion showing up. What do you think about this? And they say, well, I thought I resolved that a while ago. Well, it's probably still hanging around a little bit. And so it's absolutely fascinating. And so, like I said, somebody could have a pain in their body, for example, like sciatic nerve pain, which, that's anybody who's had it, it's painful. And so as I'm doing the spinal scan, they can actually see the picture of a spine, and it'll show a little box where they're showing the most energetic issues going on within the spine. And in, I'd say, a good 95% of the cases, that's exactly where the pain is actually coming from. Which part of the spine is it coming from? And what most people don't realize is that a lot of the pain symptoms we have, most of the time, either come from the spine or the nerves that are coming through the spine and through the spinal cord. And when we can identify that, we can get to the root cause of what that pain is, and then therefore resolve it. And that's where I think a lot of the aha moments go for the client, is to be able to see, oh, so it's not actually the muscle that's damaged or hurt, it's the nerve that feeds the muscle. Absolutely. So we're going to work on this nerve, give it some good energy, give it some good frequencies and some vibrations, because we can actually raise the frequency in each of these different modalities within the SCIO, to where we're raising it to where now the body has the potential to heal. And that's the beautiful thing. And many people will say, are you working on my eyes right now? Or are you working on my, I can feel you in my liver, or I can feel you in my gallbladder, or I can feel you in the bladder, or wow, I actually feel really good right now. I feel like I'm getting this big jolt of energy. And so I love it when people can actually feel that energetic exchange that's going on between the SCIO and myself and them.
Have people
So that's how it works.
Have people had like something really overt happen around parasites after working with you doing remote biofeedback where like dead parasites have come out of
Mhm.
their stool or something? Or you're laughing, so I think they're. Can you share
Oh
some
my
stories
gosh.
of success with parasites?
Oh, yes, I have some pretty horrific stories
I can't
actually.
wait. Tell me. Tell
So,
me.
okay. So I had this one, actually a couple of people, not just one in particular, but this one really stands out. And she had come to me because she wanted to lose weight and was very stagnant. Everything was stagnant in her body. Just really didn't feel like she had any energy and all that. And so one of the first things I found was parasites and a ton of different types of parasites. It wasn't just one parasite, it was
It never
several
is.
that were
It
residing in her
it's
body.
never just
Yeah.
one parasite, right? Because the body, like it's so true that everyone I talk to, that all the doctors I talk to that work on parasites, it's never just one, because the body's created this environment where
Yes.
they're all invited to the party, right?
Yes. And the more types of food that we feed it that it likes, then it's like, yeah, we're going to stay here because they're feeding us well.
Mhm.
So, but in this one particular case, I was working on her parasites within on the biofeedback, and she's in the room with me. So she's got the harness on, she's got the wristbands on, and they're all connected to the computer and they're all reading it. And so as I'm working on her, um, okay, this is going to freak you out, but I saw something moving in her eye,
I knew
and
you were going
and
to
I
say
looked
that.
in.
I knew you were going to say that.
Uh, I looked in closely, and there's this parasite coming out of her eye, the eyeball itself,
Yeah.
and it was just wiggling around, and she could feel it. She's like, I feel like I have something in my eye, and that's what made me look at her eye closer. Was let me see, because I didn't see her rubber eye or anything, so I didn't think she could have gotten anything in it. And as it get closer, there's this parasite and it's wiggling around, and I'm like, oh my gosh, that's so disgusting. But what do you say? You got a parasite hanging out of your eyeball. And that's pretty much what I told her. And she's like, oh my gosh. So of course she wants to look at it. And so she's looking at it through a mirror and she could actually see it. And she goes, that is so gross. And then the parasite comes out, and her, I went back to its normal healthy state. But then later she calls me, and because that pretty much freaked her out. And of course, I came home and was a little freaked out myself. And then she called me and she said that didn't stop. I said, what do you mean? She goes, I had more. And I said, what do you mean? And she goes, I had one actually come out of my stomach.
What?
So yes.
Like her
So
skin?
yes. And so
Like her belly button
yes,
or
out
her
of the
skin?
skin.
Oh my God.
It was out of kind of like at the side of her belly button. And then her first bowel movement was just, she said, ugh, she just saw a ton of them just, writhing in the bowel, in the excrement.
Mm-hmm.
And so she had been eliminating them for quite a couple days after that. But the whole idea is that we made the environment inhospitable for the
Yeah.
parasites. And so
Yeah.
they decided they wanted to leave.
Yeah.
Yes.
Any means
Yeah. And
necessary.
so, of
Exiting her
course,
body at
then,
any way it could.
yes, yes. And so that in itself, and where the parasite had exited from her stomach, a blister had started.
Oh.
So it did leave a little behind. Yeah. And so we monitored that for quite a while, but she continued to get rid of the parasites. She had lost 8 pounds in one day.
Oh my
Now,
gosh.
is that all parasites? Maybe not. Some of that may have also been that she was constipated and there was
Yeah.
a bolus stuck in her intestines for some time, and it needed to go. And then all the other toxins that were residing within the gut. And that's one of the things I like to work on a lot within my clients is gut health, because I find that gut health is the key to majority of the autoimmune issues that we have, as well as a lot of the chronic illnesses that we have, is gut health.
Mm-hmm.
What are we feeding it? And also people who have Alzheimer's or dementia or any kind of cognitive like brain fog, oftentimes it's what are we feeding the gut, because the gut brain connection is huge.
Mm-hmm.
The gut heart brain connection is huge as well. So it's really addressing the gut. And when you can address the gut and what we're feeding it, then and also getting it cleaned out, then we're going to get a much better response and longer lasting response.
How many sessions did you do with her, and did you get to the point where the biofeedback machine was saying that she was parasite free?
Yeah, I still work with her, because what happens is once you resolve one thing, then it's like, oh, can I work on this, and can I work on that, and can I work on that? So
Dude,
we still
once
really
you
watch
have
the parasites.
once you have like a
Yeah,
worms crawling out of like running for the exit doors in every possible way,
yeah,
I'm like I'm coming to you every week for the rest of my life. No kidding.
exactly,
So
exactly.
you still work with her.
Yeah,
She no longer has parasites, right? Like
yeah,
the machine says she doesn't have parasites.
nope,
And she's accomplished what she wanted
yep,
to with you. Did she get to the point where
yep,
she's got
yep.
her weight loss and now she's just working on maintaining optimal health with you?
Yeah, so now she just comes once a month just for a little pick me up or a maintenance, and not everybody needs that, but I think she she also likes the interactions that we have together. So I think it's more of a that emotional, spiritual connection that we
Sure.
have, that entangled hierarchy that happens between the clinician and the client. And so I think that's the majority of it. But and while we're at it, we're looking and we're pretty much kind of doing an overall test to see how she's doing
Yeah.
physically with insight, everything, emotion,
Yeah.
energetically too. So it's like a little like you're taking your car into a the shop for a
Fine
quick
tuning.
tune up, and that's what she comes in for. Yep. Hmm. Yeah.
How many clients, I mean, you've worked with thousands of people, both remotely and locally. How many clients have you had where the machine said this person has parasites, like on a percentage? Do you think like most
Oh,
people have parasites or 70%? Like how many,
I
what
would say
percentage?
most.
Really?
I would say a good 89%. 89%. Yeah. It really depends on what they eat.
Yeah, it's so huge. And I mean everyone thinks, "Oh, well, I don't eat sushi, so I probably don't have parasites," but I'm telling you, it's about the environment. It's
Yeah.
about the environment of the body, right? And then
Yes.
they're in our environment, they're in our food. But I'm working with a client, health coaching client for the last like 6 weeks, and she has gotten such great results. She came to me for same with you for weight loss, right? And so I'm just helping her as like health coaching, right? So I got her on some supplements, changed some things in her diet. She had heartburn so bad that it was constant heartburn, wake her up in the middle of the night, heartburn, really, really, really bad. And I think she said 6 days. On the sixth day of being on my protocol, her heartburn was gone, and she couldn't believe
Nice.
it. And then it came back a few times when she kind of went off course. So it's like the body's talking to her. She's like, "Oh, okay, feedback. Not gonna do that again." Um, and so she's changed her diet completely, changed her routine completely, going to bed earlier, wearing blue blocking glasses. Like, we kind of went down the whole list. And I'm not really addressing anything specifically with the gut, although she's eating very healthy, lots of fiber, getting lots of nutrition into her, like doing lots of fun, like little detox things, like um, going for walks, jumping on a rebounder, rebounding for lymphatic, that kind of stuff. Haven't really gotten into any herbs or anything, just general getting the body cleaned up. And now she just started passing dead 8-inch long parasites. And
Lovely. Yes.
I'm not even doing the work you do the work, and within an hour of the work that you do, you're getting parasites coming out of people. But all I was doing was helping her clean up the environment of her body. Just eat, detoxify, eat healthy, take some general supplements for like overall nutrition, clean up, the stress in her life, right? Like just very, very, very basic,
Mhm.
like foundation, building a strong body, right? And that was enough within the last 6 weeks to change the environment of her body where the parasites, becoming an inhospitable environment for the parasites, right?
Yes.
So that is so cool to see that like if we just get the body to the point where it's an inhospitable environment to parasites, that means it's a hospitable environment to our cells. to our, it's like the
Yes.
best environment we can create for our cells on an energetic level and nutrient level and oxygen level. Like that is the most inhospitable environment for, like, cancer, candida, parasites, um, all that kind of stuff. So, but you get results much faster because you're using this biofeedback machine. Um, can you tell us, do you want to tell us what it's like working with you, or like, let's say listeners who
Hmm.
are all around the world, by the way, decide they want to have a session with you. Like, can you walk us through step by step what it looks like? I know you said we mail in, so we mail you
Yeah.
saliva and our hair pulled from the root, which I did with you, by the way. When we visited you, my husband and I gave, and my our son gave you samples, and you keep them, and you don't, because I always am. I don't want to say paranoid, but I'm always cautious that companies don't sell my DNA. And
Right,
so
right, right.
this is in-house. You don't sell the
Yes.
DNA. But you
No.
have it, so you put it in the machine, and the machine, it's like like you said, like a phone number. The machine energetically links to us no matter where we are in the world. Like, this is very quantum physics level stuff.
It
And
is. It is.
you, so the client who's anywhere around the world, doesn't have to be local to you, sends you their stuff, their hair and their saliva. And then what? Can you just walk us through, like, what the experience is working with you?
Yeah, absolutely. Well, so the first thing is they can actually get to my website, which is www.natural-therapeutics.com. And on there is a contact form where they can actually send me an email saying that they're interested in wanting to receive some biofeedback, or even Reiki, or even just, like you said, health coaching. Um, and Then once I get the email, then I send them a form to complete, which is basically a medical form that tells them what the biofeedback does. It has the HIPAA information as well as their history, so that I can get a good idea. And then I instruct them to either send me a hair sample in a baggie, or if they don't have hair, because I've had some that say, well, my husband's bald, and they would want to send me hair from another part of the body. And I would say no, saliva would be fine.
So
And
it's hair.
so I
Is
would
it
get
hair or saliva?
hair or saliva. It does
Got
not
it.
have to be
It's
both.
not hair and
And
saliva.
yes, yes, hair from the head and or saliva. So if you can't go to, so some people have really short hair and they can't go to get a good hair sample. So they will then send me a saliva sample in a plastic bag.
Got it.
Once I get all of that and I get the form that's been completed, then I contact them to set up a time where we could get on a remote session, whether it's through Skype, whether it's through Zoom, whether it's through other means, or in some situations, some people will say, I just don't have time. Can you just run it and then let me know? I prefer our first session is always together, because there is a lot of interaction and exchange that occurs during that time. But in a situation where that's not possible, then I could do it without them. Then we set up the session. I say, please allow 2 hours, drink plenty of fluids before our session, because that will enhance the outcome of the session. And try to be as free from any type of distractions as possible. If you can get into a nice comfortable position, that would be good. And just plan to be available for 2 hours while I work on you. And then if they're on a Skype or a Zoom where they can actually see my session, then I explain everything to them. Because the more they know and understand their body and how it works, especially how it works energetically, then that makes them more of a steward for their body and gives them that power back. And so then the first part is I enter information from them, which is on the form that they complete, that has their demographic information. It has post health issues, such as how many surgeries, how many amalgams that they have, how many medications are they on, if they've had any steroids, how much coffee, sugar, or alcohol do they have, how much fat is in their diet or processed foods, how much water do they drink, those kinds of things, how much weight would they like to lose if they want to, that kind of thing. That then once I get that information, then I start the assessment, and that information then will give them a score. And that score is called the SOC, which is suppression and obstruction to a cure. And it's basically all of those things that is preventing them from being their ultimate and allowing them to be healthy. And then I let them know what that score means. And that score is their potential to heal themselves. And then it goes through what is considered the VAR-HOPE panel, which is the voltage, amperage, resistance, hydration, oxygenation, proton pressure, which is your pH balance, electrons, and then also some other numbers that make sense as far as their healing potential and what's preventing them from healing. Then the screen comes up with all of the 10,000 different remedies and symptomology that is identifying for them. And then I explain what each of those levels mean, like the acuity levels, what they mean for that particular person. And then if there's particular ones, this is when I start to ask for feedback from them as far as, okay, is there anything on this screen that you'd like to investigate further that doesn't quite make sense to you or what? If they don't have anything, then I go ahead and pick some that I feel has a lot to do with how they're feeling, what they're complaining about, and so on. And then we start the testing. And then once we finish the testing on that particular thing, as far as what is the acuity and how much reactivity it's having to them, then I train. And basically, the system starts to train the body to return it back to its homeostasis and return it back to normal. Then we go down different categories. So I can go into the allergies and sensitivities, and we can go into parasites and the blood and look at some of those things as well to see what's going on. I go into the spine. The computer already picks a couple of programs that it wants it to run based on the way in which the assessment was completed. And so I run those, and then we go down particular areas that they'd like to. So if somebody's having some pain issues, then I'll scan the spine, and the spine will then tell me where is there energetic blockages within the spine, and then let's resolve them. And then what emotion is holding that? We could look at the chakras and all that. If they have teeth issues, which oftentimes if I see there's a ton of bacteria going on, or if they're resistance, which means how much energy is flowing through the organs. If I see a really low resistance, meaning that it's probably a lot of the organs are very toxic because they've either had a lot of heavy metal exposure, mold exposure, yeast, fungus, parasites, that's going to make that number really low. So then I look into that further. And so then the whole idea is let's evacuate as much of that as possible so that we can get you into a really healthy state. Now, what most people don't realize is that when we're talking about detoxification, especially when it comes to heavy metals or candida or some of those, is that oftentimes the organs are already toxic, and so they can't filter like they're supposed to. So, for example, the liver is what filters all of the prescriptions that people are on. And so if the liver is already toxic and it's not able to filter or release all of those toxins, oftentimes people will see skin eruptions happening to where now they have psoriasis or eczema or some kind of acne that is occurring because their liver is basically can't filter like it's supposed to. So it's going through the skin instead, which is the largest organ we have anyway. So there's usually a correlation between skin and liver and detoxification. So I usually like to get them started on high levels of essential fatty acids so that the detoxification process can happen better. And what I mean by that is one of my favorite recipes I like to give people is Bulletproof Coffee. And the reason I like it is because of the MCT oil, which is medium chain triglyceride, and the ghee, which is a really wonderful clarified butter, organic clarified butter. And when they place it in a regular cup of coffee, like a black cup of coffee, and they blend it and they drink it, what happens is that those essential fatty acids then allow the organs to, it's kind of like they grease the organ so that things can flow through it easier. You'll actually see people showing a huge change in their cognition where they had brain fog before. Now they're like, oh my gosh, I even remember my locker combination from high school since I started Bulletproof, or things like that. They have greater energy. And so then it's really looking at dietary changes to help that process. once we finish the SCIO and we've finished all of the different programming and all that kind of stuff that's going in there, then I create a customized plan for them. And this customized plan is basically every morning do this, every afternoon do this, every evening do this, and then the resources to help them with that. I give them what their allergies or sensitivities are, so they'll know which foods they should avoid for a little bit. And then also what kinds of things, homework. I give them homework because they need to be just as motivated and involved in their healing process as I am, if not more so.
Mm-hmm.
And so I give them homework. And that homework is going to be, let's change your diet. Let's do some energetic work. So if you don't do meditation or grounding or something energetically, let's work on that. If I need to have you write a love letter to yourself, we're going to do that so we can actually start to improve some love in you. Identifying some of the stressors, things like that. So it's really a whole body, whole person type of program. And then we set up the next session. Now, typically when I start somebody, it really depends on what is their level of chronicity and how sick are they and how stagnant is their energy. If it's really bad, then I would usually recommend that we do a session once a week, just for a couple of times, just to see how their body is engaging in it and how they're responding to it. In some situations, it might be once every other week. In some sessions, it might be once a month. It really depends on the individual person. So that's how that works. And then once I finish the first session and they get their customized plan, and then we meet the next time, then they get an updated progress report after each session. And that's so that they can track their progress and they can actually and I've had some people who will actually put their progress report on their refrigerator because they're excited because they see the numbers improving, or they see less things that they're having to address, or they see the pounds going down, or whatever it is. And so it's kind of like they're taking credit for their homework that they've been doing. And so that's how that works.
Very cool. I love it. Well, I had a very interesting experience. I remember our son had his session in person, but we didn't we didn't end up hooking him up to the machine because he is I
Very,
think
very
he
active.
was I think he was still 4 at the time. He's 5.5 now. I think he was about to become 5. I seem to remember. Yeah, that's right.
Yes.
Yeah, that's right. So he was like 4 turning 5, and that's right, because it was just after Christmas. Okay. So he was still 4, very active, wanted to run around. So you actually did a remote session in a sense. He was in the building, but you did, you basically were doing a remote session. And we saw him, and it took about, I think, 2 hours, about that, give or take, maybe a bit longer.
Mm-hmm.
And what's interesting is I felt it. And it's because the mom has the energetic cord attached to their children. And so the second you turned on the program, I'm like, I felt my body vibrating. I'm like, oh boy. And then I kind of, by the end of it, I felt drunk. Like my body was,
Yes.
so big, I could feel it. But like my husband couldn't feel it. And so our son started to talk very clearly. Now he doesn't have a speech impediment, but like a 4-year-old, right? Like they're not
Mm-hmm.
enunciating like an adult. He started to talk incredibly clearly, very sophisticated, and he actually has an incredible vocabulary. I remember at 2.5, I think 2 or 2.5, he could say the word avocado, and I'm like, that's a lot of syllables for for a young kid.
It
Um,
is.
but
Yes.
he says some very sophisticated things, and his grandfather, who's a master's in linguistics, is constantly surprised by the stuff coming out of our son's mouth, um, because of how like multi-layered the sentences are, and and anyway, so as the session's going on, he starts talking much clearer, even more sort of complicated sentences. He started talking like really deep thought patterns about crystals and healing, and he's just going off on all these like interesting things that he like there's coming to his mind. But then after the session, he went to the bathroom, and he made, and normally, so he eats a pretty clean diet, so his bowel movements don't really make a smell. Like I've never noticed a smell, like beyond like, no, I mean, it's nothing. It's not even a smell. And he made it smell so putrid, so horrible. I thought like there was roadkill in the bathroom. I mean, it was the most just like
Yeah.
horrible, but his body was just expelling whatever it was expelling. It was just right after the session. And he actually normally doesn't have a bowel movement that time of day. He's pretty much clockwork. Like his digestion is really good, like clockwork. And he expelled whatever it was that was just like amazing came out of him, all those toxins. Um, and then he fell asleep. He just went boom, fell asleep in the car.
Hmm.
And he didn't have any major health issues other than he was struggling with high histamine and allergies to a lot of foods. And anytime he was exposed to one of his allergens, he would have a major asthma attack. And since that time, he has only needed his allergy or his inhaler twice, I think, in the last 10 months.
Nice.
So just looking back last 10, like
Nice.
really, like he's only had one session from you, but he was at the point where he was needing his inhaler a lot because he would be exposed to, because he's allergic to about like 9 or 12 different things. There's a ton of fish he's allergic to. So I just kind of say, okay, that's fish. He doesn't eat any fish. Um, but he also has weird allergies like garlic, which garlic is in everything. So I make everything from scratch for him pretty much
Hmm.
because garlic's in everything. Um, but he's also allergic to dust mites. And so if he goes over to a friend's house and they didn't
Yes.
vacuum every day, basically he comes home with an asthma attack. Or he did. But after his session with you, he's only needed his inhaler while his body was working through a cold or flu, which has been two times in the last 10 months. So, and his reaction to what he's allergic to has really diminished. So I'm just like, I didn't really think about it, but I saw that there was that turning point in his health after he had one session with you 10 months ago. Um, and then my session with you, my one session was also remote, and I was unconscious at the time. I was for most of the session. I wasn't on the phone with you because I was incredibly sick, lying in bed, like in and out of consciousness. But I felt you working on me. I kept kind of waking up and then going back asleep. I felt it. And then, like I said, when I woke up and the
Hmm.
session was over, my suffering was gone. The and it just like all of a sudden I knew that now it's like, okay, now I'm going to be in recovery. Like the sickness is over, the suffering's over, now I'm going to be in recovery. So that was really a very interesting experience. Um, so both of those were remote, although I mean he was in the vicinity but still not attached to the machine. So we saw results both times remote. Wait, we could talk for hours.
Yeah. And see, well, see, and I tend to, when I have children in my clinic, I tend to do them remotely because it's very hard, especially the youngest I work with is 2, um, as far as so far. So the youngest has been 2, and they can't sit still for 2 hours. I'm sorry, they
No.
just can't. So if I need to, then I will have them wear the harness for the first 10 minutes. And let's keep them occupied and all of that for the first 10 minutes. And basically, that first 10 minutes is the device doing the assessment, the calibration, all that. And then I can release the child and they can just run and have it. And I have tons of toys in the clinic so they can have some fun with that. But the difference, this is the thing that I like to make sure that most people are aware of, is that with remote or even in person, the person that I'm working with has to give permission for the device to work. It's not something where, because a lot of people get a fear factor going, thinking, "Oh, she's just going to work on me no matter, when I'm not even thinking about it." No, 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 no. The reason I contact people and say, "Can we do this on this date at this time?" is because then they're giving me the permission to work on them. And this device works so much better when you have the permission from the client. And so I won't ever work on anybody without them knowing it, plain and simple. That goes against my own ethics, but it also goes against the ethics of the system as well. And that's what I really love about it, because a lot of people will think, well, if things go sour with us as a relationship, then she could do some bad things to me. No, first of all,
Mm.
that's not in my heart. That's not who I am. Um, but the device also won't allow me to do that either.
Right.
So
It's a healing device.
that's it's a comfort. Yes,
Yeah, it's
yes.
a healing device.
So
It's not a it's not a it can't be weaponized.
vindictive. Yeah,
Right. Oh my gosh.
you're right. Yeah,
Weaponized healing
yeah.
device. Unless the person doesn't want to be healed, right?
Yes, and then that will come up that'll come up as a emotion subconsciously in one of their systems, whichever one it's impacting, and usually it'll show up resistance to change
Mm,
as an emotion. And then we talk about that and say, okay, the resistance to change is showing up. What is this meaning? Or there'll be another emotion that'll show up that will identify that they're wanting to hold on to this for a reason. And sometimes this is another piece, it'll pick up psychic attack information. So if there's someone within your energy field who is not wishing you well, or who is vindictive, or who is or just left their energy on you, for example, you go to someone's house and you can actually feel the negativity in the house, or you can feel something,
mm,
and then you go home, that psychic attack number could be really high. And so then we have to clear that aura. We have to clear that energy out. And I do it through the biofeedback, but then I also give them tools that they can use to also do it as well. Because if they've been attacked once, it's potentially been attacked again and again and again. And so let's teach you ways in which you can actually resolve that and protect yourself. I also teach people how to do muscle testing on themselves to see what food is good for you and what food is not good for you. And then when they're in the grocery store, like in my little small town, I could be walking through the grocery store and I see people muscle testing themselves. I'm like, yes, it's working.
yeah. Yeah. I love that. I
Exactly.
love that. That happened to me.
Hmm.
There's a
Yeah.
store near me. It's a gluten-free store, which is so cool. Because we've been gluten-free for 10 years, no barley, wheat, rye, or oats. And and this store is like celiac gluten-free. Like there's absolutely like everything is certified for celiac. Um, and there was this woman who was like, I don't know if I'm gonna be like if I'm gonna react to this or not. And I think she was choosing all the different breads, or I can't remember what she was choosing, but there was a bunch of different ones that she wasn't sure which one to go with. It was her and myself were the only customers in the store at the time. And I said, I was like, have you heard of muscle testing? And so I had her drop her purse and her cart, and
Hmm.
the owner, who's the only employee at the time in the store, is staring at us, kind of looking at me like I'm crazy. um and I showed her how to muscle test, and it was very clear, like the one product.
Uh-huh.
I had her close her eyes so she didn't know which one it was, but I showed her, and then it was really clear which one. It was just like a really strong signal, like she just this is the one. The other two were weaker. And I showed her, and she was just like, "Oh my gosh, that is so cool." Um, it's pretty interesting how we can, when
It is.
we listen to our body, when we check in with ourselves, and even if you just check in with
Yeah.
yourself, like after a meal, like, do I feel weakened? Do I feel tired? Do I feel energized? Like, check in with yourself, even emotionally. Like, how do I feel emotionally after a meal? Because my husband and I have both noticed that with certain foods, like we'll feel angry afterwards, or we'll feel like
Hmm.
really easily irritated. Like, I'm fine, but everyone else is pissing me off, right? And it's just interesting that we've
Right.
been able to correlate that with certain kinds of food or certain kinds of meals. That it affects our energy, it affects our emotions, it affects our hormones, it affects, there's so many things beyond just digestion that are affected by what we bring into our body.
Well, and also not only that, but there's also how we eat with intention.
Mm,
Because sometimes I would say the majority of our population, we are very distracted when we eat. We're either watching TV, we're reading, we're having conversations, or we're drinking way too much water, or we're drinking too much of something while we're eating. We're not chewing our food enough. So we're wolfing it down. We're eating a meal within 30 minutes and it's done, or sometimes 15 minutes because that's how long you have for your break. But that's a leading reason why people have acid reflux and acid indigestion, is
mm-hmm,
because they're not chewing their food enough.
mm-hmm,
Because like I mentioned with you before, is that 50% of the digestive process happens in the mouth. That's where digestive enzymes start. And so if people aren't chewing their food enough, then the stomach then has to produce so much acid to break down that food so that it can
Mm-hmm.
actually go through the whole rest of the digestive process. So if people aren't chewing their food enough and really tasting it and enjoying it and loving every moment of it, then they're not getting the true essence of that food. And that also goes for smoothies. So we're into these smoothies of nice, wonderful plant-based smoothies that have wonderful greens and vegetables and fruit and all that in it and protein powders, and we're gulping it down. Well, the same thing happens. The gut still has to process that. It still has to break it down. So we need to go through a chewing motion, even with smoothies, and just activate the digestive enzymes when you're starting to drink that smoothie, and you'll get more nourishment. You'll get more nutrients. Won't have as much acid. And as we know, alkaline is the way we want our body to be. So the more alkaline we can get our body, the better. Less disease process, less breakdown, less degeneration. So if you eat slowly, eat with intention, eat with love attached to that food. And then also, there's another trick that I learned when I was in nursing homes, because oftentimes appetite would be a big issue for us where we couldn't get them to eat. Serve food on a red plate. Use red in your utensils on the serving plate, because red actually increases appetite. You could tell
Huh.
that through all the advertising. Think of all of the fast food restaurants. What color is very prevalent in their advertising?
Yeah, red,
Red.
yellow, and orange, and that's usually I remember in the 90s, like any fast food restaurant you went to
Mhm.
was all variations of red, yellow, and orange. They've kind of come away from that. Well, people aren't eating in anymore. They're all drive-through, but a
Uh-huh.
lot of their logos are
Yes.
that color, and like you said, their advertising and their packaging is that color. Um,
Mm-hmm.
that yes,
Well, the
then they
size of
have
the plates. Look at the size of our plates.
they're huge.
When we're back in the older days, the plates were about the size of our butter plates now, or our salad plates.
Mm-hmm.
And so when you would fill up that plate, you would look like, okay, that's a lot of food. Well, now, if you look at most of the plates that are in our homes, they're platters, and we feel like we need to fill that platter. And so then we fill it up, and then we are eating not consciously. So then we eat that whole platter where you
And we're
probably
not
only
chewing.
needed half.
Like you
Yes,
said, we're not chewing, and so when we don't chew enough, we'll eat twice as much volume until the
yes,
satiety mechanism is triggered in the brain. But if you don't chew enough, then or you eat too fast and not chew, which is what almost everyone does, you're not triggering, like you said, the liver and the pancreas and the stomach. All three of them need to be told
mhm,
to start producing their enzymes, and the hydrochloric acid, and the bile. Just start producing all of it, for
mhm,
release into the stomach and into the
yeah,
small intestines. And so chewing is turning on the whole system. It's like you don't put your clothing in the washing machine and just leave it. Like you have to turn it on and program it and set
mhm,
it. But it's that's what turns on digestion. But when we have a huge serving, which like you said, we've gone from a 6-inch plate to a 12-inch plate, we're doubling the amount of
mhm,
food we're consuming at each meal and eating it so fast the satiety mechanism isn't triggered. That and the food most Americans eat is so low in fiber that it
yes.
doesn't bulk up. Plus, we're not drinking enough water, so we're chronically dehydrated. So all these things lead to sort of digestive disaster and creating that perfect environment
Yep.
for all the worms and parasites to live. And so,
Well, and also when you think about how long does it take for certain things to digest? So, for example, vegetables take about 2 to 3 hours to digest. Fruit takes, oh, wait a minute, that's the opposite. Fruit takes 2 to 3 hours to digest, vegetables 3 to 5 hours. Meat could take up to 3 days to digest. So, and then you add the heat of the digestive process, which is all the acid that's breaking it down, like you said, the hydrochloric. And so then if you think about the food choices that you make as well, the longer it sits in the gut, the more bacteria it will grow, which is why we get a lot of constipation, why we get a lot of digestive issues. So think about how long it takes for things to go bad if you were to leave it out on your counter. So for example, if you were to leave an apple on your counter for 2 to 3 hours, do you think it'll be fine for you to eat?
Sure.
Yes. So as it's going through the digestive process, it's a clean food to eat. The vegetables, if you put a piece of broccoli out on your counter for 3 to 5 hours, will it be safe to eat?
Raw,
Yes,
raw or
because it hasn't
cooked?
started to break down yet.
Oh, okay.
Raw.
Yeah, raw, totally
So raw,
fine.
it's going to be a little limp, possibly. It'll be fine. But so it'll go through the digestive process. Now, put that nice piece of red steak out. And I'm not telling people they have to be vegetarian or vegan, but if you put that red steak out on a counter for 3 to 5 days, raw,
Ugh,
will it still be good?
no.
Okay, so then as it's going through the digestive process, why are we assuming that it's going to be okay and that we're not going to get any bacteria or, let's say, parasites and stuff like that coming from that meat? So when we make our food choices, we need to keep that in mind as far as how quickly does it dissipate? How quickly does it digest? How quickly does it go through the digestive system? And if it doesn't go through quickly, then we know we're going to have some digestive issues. So let's do some things that's going to help the digestive process. Mastication. Eat it, chew as much as you can. And I remember the first time I heard about this whole thing about chewing your food 30 times per bite. My husband and I were at a seminar, and what was so funny is that night we decided, let's do this. So basically, we made this dinner, and for each bite, so he took the first bite and he holds it up. And he goes, "This bite is going to improve my eyesight." And then he chews it and he chews it 30 times. So then I take a bite, and I said, "This bite is going to give me the best bowel movement ever." And then as we were going, we keep saying with intention what each bite would do. And we had the most fun at that dinner. We basically took almost 2 hours to eat. We ate half the food, and we were very, very
Satiated?
happy with the amount of food that we got.
Nice. Yeah.
Satiated, and we just had so much fun with that meal. And if people just did that, they would actually see a huge change in their whole digestive process, plus lose a lot of weight as well.
Yes. I love it. And
Hmm.
then
Hmm.
eat food with lots of fiber, like the fruits and the vegetables. And then,
Yes.
that's something I learned when I was about 6 years old, and my mom and I were both very sick, from the standard Canadian diet, standard American diet. And my mom took us to see Dr. Diadamo, and he gave us this poster on food combining, and it hung in our
Hmm.
kitchen until we moved when I was 19 years old. So I have it memorized in my brain because I saw it for so many years. But this concept really stuck with me early on. I've been fascinated with natural medicine since I was 6. Just wanting
Nice.
to, like yourself, wanting to absorb everything I could possibly get my hands on, just having an insatiable curiosity. And as a child, just, that childlike desire to consume knowledge, right? Um, this idea that an apple, and you said digestion takes 2 to 3 days. What you meant was the entire from beginning to end. But in the
Yes.
stomach itself, an apple takes about 20 minutes, I mean, just give or take, right? And the steak could take about,
Yes.
1 to 3 hours, right? Just give or take, like how much you ate, like, how much you chewed. Um, if you ate, and this is Dr. Diadamo's, one of his points was, if you ate like a steak dinner with an apple pie, right? Um, the apple only needed to be in your stomach for 20 minutes before it should have been passed on to the next phase of digestion and absorption through the small intestine. But because you also ate steak in the same meal, so this is food combining, your body
Yes.
is now fermenting the apple for 2 hours
Yes.
while it's so beyond digestion, it's fermenting at this point, which is unhealthy for the body to have any large amount of fermentation of food while it's trying to digest the apple. And different enzymes are used for apples, and different juices are used for digesting steak, and so they're combining. um and then finally it gets passed on to the small intestine, but at this point it's just fermenting the entire way down, which can actually, and what I've learned more recently, feeds the microbiome of our gut, the very complex microbiome, feeds it sort of unhealthy nutrients, which then the microbiome turns around and makes things like ammonia and makes other
Yes.
chemicals in the body, which then go into our bloodstream and affect our brain.
Yes.
And so food
Yep.
combining is a
And we become
huge thing.
inflamed.
Right, right, the whole body,
Yeah,
right?
and
So
we become inflamed. Yeah.
yeah, and so the it's not it's even more so like what we eat, when we eat, how we chew, all of that, and then what our microbiome will then turn it into. And I love that you brought up that like we have to really consider when you eat meat, how long does it stay in your body? And that's rotting flesh that is
Yeah.
kind of creating that petri dish for the bacteria. And if you don't chew, then it really is doing a number, and your microbiome actually then turns it into other things that's unhealthy for the body as well. So beyond just like meat, if someone says, well, meat's not necessarily unhealthy, the microbiome will turn it into chemicals that's unhealthy for the body, especially if you didn't chew, especially if you don't have strong digestion. Um, so it's all those things we have to take into consideration when you work with people. And I think you may have answered this question already, but just to be very clear, when you work with people, does the remote biofeedback look at this specifically? Like look at digestion at this level?
Not at as far as like where it is in the digestive process. Part of that is the information that we exchange together. So first of all, one
Mm-hmm.
of the first questions I ask, well, several questions down the road, is how many bowel movements do you have in a given day? And if they say, oh, maybe one every other day, then I'll say that's not enough. Especially, how many meals do you have? If you have 3 meals a day, you should be having 3 bowel movements a day.
Mm-hmm.
And if they're not, then that's basically saying that their digestive process is too slow. And so therefore it's growing bacteria. It's growing all these different things in the microbiome that is not healthy for it. And that could be leading to that why they're so fatigued. Because that food, basically, if you're not getting the nutrients, you're not getting the food you need to fuel your muscles, fuel the blood, fuel all that. Plus whatever disease process we're starting because of that rotting flesh or whatever. But then I also ask, what is the quality of the food you eat? And out here where I live, most of the people here grow their own they have their own cows. Basically, they're grass fed. They're they love them all the way to the slaughterhouse, all that. But when you're buying the meats from stores that maybe having these farms of cows or chickens or whatever, where they are not living in a very good environment, and then the stress hormone is released as soon as they go into the slaughterhouse, then if you see a change in your mood, like you were mentioning, sometimes you'll eat certain foods and all of a sudden you're irritated or irritable or angry or whatever. Oftentimes people who are very energy sensitive, meaning that they may be an empath or they may be taking on other people's energies or other souls, they may be actually feeling or consuming that soul of the cow or the chicken or um, the poultry, whatever was killed. And if it wasn't killed in a kind way, or like in just the general slaughterhouses, then the stress hormone gets released into the meat. And then when they consume the meat, they are then consuming the stress of that animal. And so I always say, just really just be careful and cautious, and really uh, think about what it is that you're eating and what did that animal go through during their life process, um, and was it healthy? If it was one that was created on those manufactured places where they have no quality of life, they're just, in a stall, then that meat is going to be very stress related. There's not going to be a lot of nutrition in it. And therefore, there's probably more hormones and things like that that's been added to it. So you're not getting the good quality. So just be really careful about your food selection, where you get it. And, if you do eat from farms and stuff like that, where they love their animal all the way to the slaughterhouse, then, you can pretty much rest assured that that should be less stress related hormones in the meat as well. But that's a consideration to think of too.
I've heard that from other people who are empaths as well, that they've had that personal experience. My husband and I
Hmm.
had that experience when we lived in Las Vegas, long before we became plant-based. We were like 100% meat eaters,
Mm.
like carnivore diet all the way, meat at every meal, sometimes just meals with only meat. And we went to a place called Roberto's, which had like the best Mexican restaurant or Mexican food. And we got home and we ate the same thing we always eat there. Like it was like carne asada burrito or something. It was just, I don't know. We had it 50 times before. But this particular time, for whatever reason, both of us had pounding hearts. We felt like we had done, I haven't done like street drugs, but it was kind of like cocaine or something. Like our hearts were pounding out of our chest. We're both sitting there at our chairs, just like sweating, breathing heavily, feeling incredibly scared. We don't know what's going on. And if only one of us
Yeah.
had had that experience, we would have been like, take me to the hospital, I'm having a heart attack. But both of us felt terrified and our hearts were pounding. And we're like, this is from the meat. Like something happened to this cow. And
Mm.
this happened to Duffy and I like
Yeah.
12 years ago. And that really stuck with me, that memory. And it lasted for like hours. We're just sitting there with our hearts pounding and just in total fear, both of us, right? Like we had taken some crazy drugs, and that was, it just was really clear to us that there was something about that cow that we felt, that was imprinted on us. So we just have to think, if energy is so powerful that you, Vienna, can do energy work across the world and help someone gain health back, then energy from our food could heal us, or harm us, bring us closer to being in balance or further away from being
Yeah.
in balance. And so we have to take that into
Hmm.
consideration. I love that practice you developed with your husband where you chewed each bite 30 times and talked about
Yeah.
the intention of what each bite would heal. Now, I've met you in person. You look like you're in your 40s, but how old are you? May I ask?
I'm actually 58. I'm 58.
You look, so did you notice that as you did all this work with integrative medicine that you got younger, that you looked younger, that you felt younger? Did you notice that?
Absolutely. Well, and also what adds to that is I do a daily practice every morning and every night. I do my meditation and my yoga first thing every morning. I don't miss it. And then I also do the same practice in the evening as well, and I don't miss that either. And that's me loving myself. And since I've started that, oh my gosh, the change has been so phenomenally different in that, first of all, sometimes I could have a lot of people after me for whatever reason, and I don't feel it. I don't give it attention. It doesn't affect me. Minor stresses, like things that are happening in your life that could typically be a major stressor, it doesn't stress me out anymore. I'm just in this wonderful little vortex of love and the gratitude and blessings. And one of the things that I do that is, I think, is a really good homework for everybody is start your morning with at least 5 minutes of gratitude. Be grateful for whatever it is that you have in your life, or what is it that you want in your life, and assuming that it's already happened. So let's say I'm wanting this vacation, let's say, for example, and wanting the airways to allow us to fly again, and all of that. And I'll just say, thank you so much for my trip to Hawaii or whatever. I'm enjoying it so much, or whatever. But I'll spend some time in gratitude in the morning before, as I'm starting my day, and saying what I'm grateful for that's going to happen that day. And then in the evening, I spend another 5 minutes in gratitude of what I was grateful for, of what happened that day, or what's going to happen throughout the evening. That I'll sleep well, the pain that I have in my back will go away, or whatever, and just spend that time and just sharing out the gratitude. Right now, in this world that we're in right now, there's so much division, there's so much anger, there's so much resentment, so much division. And I believe that if we just approach each person with love, with understanding, with gratitude, with blessings, with the highest level of energy and frequency that we can change this world. But right now, there's so much anger, and there's one word in the vocabulary that I don't allow in my vocabulary, that I don't even say, but it's the HATE word, and I don't include that because it's used so. frequently in vocabulary these days. You can hear somebody talk and say how much they don't like this one thing, and you'll hear them use that word 25 times
Mm.
within the conversation. That is such a strong word. And it's not only the words that we say outside, it's the words that we say internally. So, what is our own internal monologue saying? And we're always comparing ourselves to other people, or that we're in lack, or that we're not good enough, or that, whatever. So, if you just start your day out with, the blessings, the gratitude, the I am's powerful, the I am phrases, things like that, then we can change our own internal bioterrain without medications, without lots of intervention. It's just, what do we say to ourselves? Because our own self-talk can be very toxic in itself, and it will make us toxic. So that's what's made me younger, is that daily process. And I'm also plant-based. So I don't do meat. If I'm at somebody's house and they're serving meat, I will just bless it rather than make them feel uncomfortable about serving me that. There's only one that I typically won't, and that would be pork. I pretty much will stay away from that, just because most people don't realize that pigs do not have sweat glands, and so whatever they eat is
Mm.
in their meat. Yeah,
Mm.
so
Well, and the
I avoid
horrible
those.
conditions, horrible, horrible conditions that
Ah,
the poor pigs are raised in. Um,
yes,
I've said on the show before, I loved eating meat. I was really into it, and then I just kept learning over and over and over and over more and more about the benefits of not eating it, right? And the benefits of eating plants. And my
hmm,
husband actually just
yes,
turned he was the biggest carnivore in the world, and he just said one day, he just woke up and said, I'm never eating meat again. And I'm like, okay, I guess I'm cooking that way since I'm the one that cooks for everyone in the family. Um, and I just started, I was very afraid of not eating meat. I really thought that I would become weak,
hmm,
frail, that I would be sick because I tried being vegan before, I tried being vegetarian before, doing it all wrong, eating a lot of processed food in the mix and just really feeling
yes,
sick, right? Yeah. I tried to go vegetarian when I was a teenager and I ate just like vegetarian pizza and subs. Like obviously
yeah,
not healthy choices, right? But in my
yes,
mind, it's like, oh, I'm not eating meat. I should feel great. Oh, I feel worse. Oh, apparently meat makes me feel good. So in my mind, I had this like belief, and I've met a lot of people who have this belief that meat gives you energy, meat makes you feel healthy,
yes,
and so whole food plant based is not vegan, it's not vegetarian in that it's like Oreos are vegan, right? Like it's not whole food plant based is I'm choosing to not eat processed food, but also it's not black and
yes,
white. And I really like that you acknowledge that you're not 100% never ever eating any animal product, because I think that there's this like in our minds it's like a black or white issue, like I either like for the rest of my life I can't eat any of that. Oh my gosh, too much restriction, I can't do it. It's like you're just doing your best every day. You're just making really good choices every day. And if once in a while you have an animal product, like you said, you bless it, you're grateful for it, you're grateful for the life it gave you, and you move on,
yep,
right? And then but you focus
yep,
on eating as much plants as you can and nurturing your body as best you can, because that guilt and shame that comes with feeling like I can't do it, oh my gosh, I failed or whatever, like all of that's toxic. um and I think that
that's that
there's
self-talk we were talking about.
right, yeah, and there's this
Yep,
idea about being vegan is like it's all or nothing, right? And I've met even vegans that are like,
yep,
no, 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 no. It's not, see, because there's vegan shaming out there. So it's like you start getting shamed
yes,
by a vegan, and then it just turns there's a lot of negative emotions around it. And then people get really turned off by it. It's not on or off. It's do as best you can, right? Good, better, best. If
yep,
everyone just did as best they could, and just like, well, how long can you go just eating an amazing variety of plants, right? Like great, you made
yeah,
it 2 meals without meat, great, you know what I mean? Like that's sometimes what
yeah,
it starts with. Sometimes it's just like meatless Mondays, or 2 meals a day, or a whole week of meatless meals, and or maybe only at Thanksgiving or whatever, right? So it's your
hmm,
ability to just choose healthy foods for you. And I think as a society, we're over consuming meat products and totally under consuming plants. And I think we need to switch it
It's
up,
true.
right? So like, we need to overconsume
Well,
plant products in the most balanced and healthy way.
and it's also looking at how we prepare it too. So another
Mm,
thing that we do in our home is when we are preparing our dinner or our meals, we have wonderful music playing in the background. We are putting love into our food. We're purposefully putting that love of intention into the food, that this food that we are preparing with our own hands is going to provide so much nutrients and so much love to this person who is consuming it. And we surround ourselves with it. So we have this nice little essential oils going on, we have the music, and therefore we're influencing it with our own energy as well. And then, oh my gosh, the taste is amazing after that because,
right.
like, wow, versus if you're making a meal in anger. Let's say you're angry at your husband or
Mm,
you're angry at your wife and you're making this meal, then they're ingesting your anger in that meal as well. So it's similar to that animal going to slaughter. If you're making a meal in anger or frustration or resentment or even just sheer fatigue, then how does that influence your food? It influences it a great deal, even if it is a plant-based food, because plants have energy as well. They actually communicate. There was actually a lie detector expert who was testing his plants one day on his lie detector equipment, and he found that they respond to his thoughts or his words. And he tested them, and he was testing them with adding cold water to see how would they respond. And the needle would move, but they would recover. Then he would add hot water, and the needle would move even further, but it would recover. And then he clipped the plant, and yeah, okay, it didn't like it. The needle would move, but the plant still recovered. Then he had this thought, I wonder what would happen if I burned the plant. The needle moved, and the plant never recovered from that. The needle stayed where it was.
just the
He
thought
never
of burning
even
the plant.
burnt the plant, just
Yeah.
the thought of burning the plant. So those people out there that say they don't have a green thumb, change your perspective, love that plant, put a lot of love into it when you water it, when you talk to it and all that kind of stuff, and you will be a green thumb. But the same thing goes with the preparation of your food.
Well,
Put
and
love into it.
while you're preparing and loving your food and loving your body, that's actually turning on digestion even then. Maybe an hour
Yes.
before you sit down to eat, you're chopping the food, you're sautéing or steaming, all of that. You're seeing it with your eyes, you're smelling it with your nose. Maybe you're even tasting things as you're seasoning it with the herbs. And you're in a state of not stress. So you're in the autonomic nervous system's parasympathetic response of rest and digest, and not in the state of fight or flight, right? Because you're listening to the music, you're in a
Yes.
state of love. So now you're turning on digestion with the nervous system response, getting out of stress mode. So you're prepping, you're spending like an hour before you even eat the food. Your body is prepping for and getting ready for and excited to help you digest. And then you sit down and you
Hmm.
have gratitude and prayer and you chew your food slowly and plentifully. And the entire time, your body is going to get the most amount of nutrients out of that food because it's in parasympathetic nervous system response of rest and digest. Um, all your hormones are in alignment with taking that food and turning it into nutrients. So it really does come back to the holistic approach that our lifestyle choices matter. That your meditation and gratitude, daily yoga, all of that really does matter. That you intentionally cook, prep, grocery shop, plan, and eat with intention of love and healing your body, that matters. And that the amount of stress that we go under, think about people who are stressed out, go through drive-throughs, wolf down their food, hardly spend any time digesting or prepping the body for digestion, don't even chew very much, are choosing foods that sit in their body and rot. No wonder we have the nutrient deficiencies we do, and the state of disease we do,
Hmm.
when we're not really taking time to energetically, emotionally, and physically nourish ourselves every day. So you're such a wealth of information. I'd love to have you back on the show. You have a segment where you're going to teach us how to read our tongues, but I'd like to save that for our next interview. Um,
Perfect.
I'm going to make sure the links to everything that Vienna Lafrenz does is in the show notes of today's podcast at learntruehealth.com. Now, you also have a book you wrote a chapter in with many other very famous healers and holistic practitioners. Um, and the link to the book is going to be in the show notes as well. The book is called Wake Up: Miracles of Healing from Around the World. Can you tell us a little bit about that book and what people would get out of reading it?
Yeah, so it's a compilation of about 40 different authors, and they're all healers and of some form or fashion. And basically, we were asked to write a chapter on the miracles that we have experienced, whether in our own lives or through the lives of our clients. And it's really a compilation of all of that. And I think it'll give some people a really nice, fresh perspective of the potential of the body to heal, as well as the mind and all of the different stories. There's some really amazing healers out there, different modalities that are being used. And I truly feel like it'll open up a lot of people's minds and perspectives to just the potential of the body to heal, the number of amazing stories that were shared, and the different types of healers that are out there, and just the sheer love that they have for the healing process.
Awesome. Now, Vienna, your website is natural-therapeutics.com. And of course, that link and the link to the book is going to be in the show notes of today's podcast, learntruehealth.com. I want to have you back. We've got it. There's so much more we have to talk about. You, after you and I spoke, you got a platinum energy system, which I've had Kellyanne Andrews on the show several times. And many of my listeners, I think at least 100 of them, have purchased a platinum energy system and are using it for themselves and their family, and some of them for their clients. And I keep getting some amazing feedback coming back from one of our listeners, actually, I believe she said she's an ophthalmologist. Her family was diagnosed with COVID, actually, all positive tests. And when they use the PES, that their suffering ended, and that it sped up their healing. And it was really cool to see that. And I've had that experience with the PES before, where anytime I have a cold or flu, which I don't often, but when I do, I jump in it and I really feel like it sets the body back into healing mode quickly. So you've had some great experiences with that in your clinic, which would be cool just to hear about, because I love hearing stories of healing and success, especially with natural medicine. And then you have all other kinds of therapies. Of course, today we focused on remote biofeedback. And one of the reasons why I really wanted to focus on that is that obviously many of my listeners are not near Republic, Washington. And so how you can help them, and you can, is by working with them remotely. And you do that on a holistic level. You're looking at emotional, mental, spiritual, energetic, and physical, while working with people around the world. And then it'd be really cool to talk more about your other therapies that you have in-house, especially because so many of my listeners are either in the holistic space in one way or another, or want to become a practitioner like you. So you're inspiring future generations with what you've shared today. So I'd love to have you back, and I also really am eager to learn from you about the tongue and how to read it and what we can do with that
Yes.
information. So we'll have you back, and you'll share with us all about that. That'd be really cool. Is there anything you'd like to say to wrap up today's interview?
Well, first of all, I love your interviews. They're very thorough, they're fun, they're exciting. Obviously, we could go on for hours, and it's always nice to be able to talk to a friend like that. And I love the fact that they're also widespread as far as different topics. I feel like more and more we need to have more of this type of stuff going on, so that it meets more ears that are
Mm-hmm.
open and that are kind of at that desperation stage of, what do I do now? I think even more so now with the whole COVID-19, one of the things that really opened things up for me was this remote healing piece, because of the lack of um, potential to go to people in person, and the way in which it helps to heal. And also the other pieces of it with the emotional frustration that people are having of not being able to see their loved ones and stuff like that. So it's even more so. But I love what I do. I love giving people their power back, and helping them realize that they don't even need me necessarily to heal. And, I may be working myself out of a job, but the more empowerment that we could give our clients to where they are able to then see their own potential and their basically limitless potential of healing themselves, then that's where I feel like I've done my job, is getting them to that level and not needing me anymore.
Yes.
So,
You work yourself out of a job
mhm.
by helping people get to the
Yep,
point where they don't need you anymore.
yep,
But it's fun to do
exactly.
the check-ins. I know
It is.
I definitely want to have a few more sessions with you. It's so cool because it's layers, right? You peel the layers away. Thank you so
You
much for
do.
coming on the show. It's been such a pleasure having you, and I can't wait to have you back.
Thank you. I appreciate it, and I appreciate all your your listeners as well.
I hope you enjoyed today's interview. You know, there's 53 days left till Christmas. If you're listening to this the day I publish it, if you're listening to it later, Christmas is just around the corner. And I love giving holistic presents to my friends and family. I'm going to tell you a few that I absolutely love. The magnesium soak. You can listen to my interviews. Just type in magnesium soak at learnyourhealth.com and listen to those interviews. Absolutely amazing. Kristen Bowen was 90, I think she said she was 97 pounds, having 30 seizures a day in a wheelchair, unable to talk. And now she's in perfect health. And she attributes that one of the biggest things that helped her was her magnesium soak that she sells on her website, livingthegoodlifenaturally.com. Be sure to use coupon code LTH when you go to her website, livingthegoodlifenaturally.com. Coupon code LTH. I love the magnesium cream. I love the magnesium soak. You put it in a foot bath or put it in your bathtub for you and your kids. And I also love the magnesium muscle cream, which is amazing for aches, pains, and tension headaches. So that is absolutely must be on your Christmas gift list, your holiday gift list. My other great gift I love giving my holistic friends is energy bits. Go to energybits.com. Grab a few of the bags of energy bits for your sister, your mom, your best friend. They are fantastic snacks. You know, kids love them too because they make your tongue turn green or blue, depending on whether you get the chlorella or spirulina. They help to detox the body. They're filled with readily available protein and tons of vitamins. And I have some, like, I think I have like 7 different interviews about chlorella and spirulina, specifically about the Energy Bits brand. And I've interviewed the founder of that company. You know, there's only 2 companies I know of that do not contain any lead in their chlorella. So if you buy some over the counter, some, you know, go to some health food store or whatever and buy some chlorella, there's going to be that little warning on it that says this, in the state of California, this causes cancer. That's because there's actually lead in those bags of chlorella. But in Energy Bits, in their chlorella, there's 0 lead because of their process of how they grow their crop and how they then turn the crop into the little edible tablets. So listen to my interviews on the magnesium soak with Kristen Bowen. Listen to my interviews about algae, the healing benefits of algae, and how it's such an awesome superfood snack to carry around with you. Listen to my Energy Bits interviews and use coupon code LTH at energybits.com and coupon code LTH at livingthegoodlifenaturally.com. Those are 2 amazing websites to check out for your Christmas gift ideas. Always use coupon code LTH. I try to get companies who I absolutely love and adore and recommend to always use the same coupon code. So just always try coupon code LTH on all these health websites and you'll be pleasantly surprised when you get a great discount. Awesome. Enjoy today's interview. Come check us out in our Facebook group if you haven't already. We have such a supportive and wonderful community. You can ask your health questions there and support the other members as well. Just search Learn True Health in Facebook and come join the excellent community, a very supportive, holistic community there.